And once again, just to let you know, this meeting is now being broadcast on YouTube and our meeting portal. Hello, Sandia Herman, could you do a microphone check for me and confirm?
Yes,
that's
hello. Can you hear me?
Yes, we just saw you come in as an attendee and promoted you to panelist, wanted to make sure.
Oh, okay. Thank you.
No problem.
Good afternoon, Jeff and Cindy.
Hello there.
Rhonda, can you hear me?
I sure can.
Rhonda, this is Laura Garnett. Can you hear me?
I sure can. Thank you very much.
Thank you.
Hi, Molly.
Sorry, I was having technical difficulties. Hello.
No worries. We can hear you loud and clear. Thank you.
Great, thank you.
Hi, Rhonda. This is Miguel. Can you hear me?
I sure can. Thank you.
Thank you.
Hi, Rhonda. This is Paul Lorenz. Just want to check to see if you could hear me.
Hi, Paul. I can hear you loud and clear.
Right, good afternoon.
And hello, Supervisor Wasserman. Sorry, I did not mean to step all over you, Paul.
Hey, Rhonda.
Good afternoon, everyone. A
Yeah.
1-minute warning, Mr. Wasserman, only one.
Good morning, Madam President. Good afternoon.
Could you ask if we've received
Hey, Susan.
Hey, Mike, how you doing?
Doing all right. Just don't like this 10 more days in the 90s for Los Gatos. Looks like San Jose is going to get a break the next 3 days. Wow, that's amazing.
So we're going to begin our meeting, and what I'm going to do is just give our colleagues a minute to open up their screens so that we can begin the roll call. I just want to make sure everybody's on.
I have not yet seen Supervisors Cortese and Semidian.
Yes, I saw Supervisor Semidian in the hallway here, so we'll just give
Okay,
everybody a
good.
minute. And oh, good, Supervisor Cortese. And as we're getting started, there was a request that I made a bit ago about making sure we had the referrals for each of our sections on the day that we were hearing them, because I wanted to see what was still in the works. And what I'm going to ask is, Dr. Smith, is that something that can be available to the board by Friday before we take final votes?
Yes,
Thank you.
we're working on it right now.
Thank you. Let me just give by any chance, is Jeff Draper on the line? No.
And that makes 5.
Wonderful, thank you. Oh. All right, so we brought our own fan up here. Whew. All right, we're gonna get started. Thank you all very much. I'm gonna ask the staff if they could do a roll call for to begin our second day of budget hearings.
Supervisor Ellenberg,
I'm here.
Supervisor Semidian,
Here.
Supervisor Cortese,
Here.
Vice President Wasserman,
Here.
President Chavez.
Here, thank you.
Thank you. You have a quorum.
Thanks very much. I'm going to turn to Supervisor Wasserman, who is going to lead us in the pledge. Please stand if you're able.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We're now going to go to public comment. This is an opportunity to speak to an item that is within the purview of the committee, but not on the agenda today. So I'll give folks just a minute to, if they'd like to participate in public comment. And if you would like to make overarching comments about the budget, but not something specific, that would also be appropriate to do so now. right, so we will go to, I'll ask the staff if we could begin calling on our public speakers. This is public comment, and we have 7 speakers. I'm gonna just let folks sign up. We'll give just a minute more for folks to know that. I know we got some information under public comment, which is why I'm giving folks an opportunity to sign in. All right, so we have, if we could go ahead and begin calling on our public speakers. Each speaker will have 1 minute. If I could ask the clerk to call the public speakers.
Our first speaker is Maya Shi. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Maya Shi.
Could you do
Yes.
something?
Can you hear me?
Yes.
You can hear me, so I can begin? I can start it?
Yes, please.
Okay, good afternoon, ladies and gentlemen. My name is Maya Shi. I am a Mountain View resident and a patient at the Northeast Medical Services, where I have received excellent primary care services for the past 6 years. I urge the County Board of Supervisors to refrain from making $400,000 in cuts to our community health centers. This pandemic is not a time to gamble with the health of our community, especially our immigrant and low-income communities. As the virus continues to spread and the number of unemployed rise, we need our health center to continue doing what they have done for decades, serving as a lifeline for our most vulnerable population. We need to take a bold action and stand up for our vulnerable communities and invest our health center.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute and you will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, Scott Largent. I think it's very important to keep the public in the loop. I know I talk a lot. I talk way too much. It's a form of therapy because I don't get the right services out of the county. I try to keep people up to speed on the trial that's coming up. I made sure to let everybody know the other malicious prosecutions. Now, the important part about this is that I always kept the public defender's office in the loop. I always have. I made plenty of phone calls to Damon, Silver, same with Molly. You know, I want them to know what's going on and I want to keep them in the loop. They don't care. Now, you guys hear that a lot. I wanted them to figure it out, kind of sit side by side. And I have more than rolled out that red carpet right now for them to understand what law enforcement did, what the city did, and what the DA's office did. They're going to turn a blind eye. And this is what they're doing to a lot of people. And I think I'm at the right budget hearing for this one. So thank you.
Our next speaker is Alexis McNabb. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, thank you. Hello, my name is Alexis McNabb, and I'm a member of Showing Up for Racial Justice at Sacred Heart and a resident of San Jose. I'm calling in support of the Silicon Valley Debug's Protect Your People budget to divest in the district attorney's office, the sheriff and jails, and probation, and invest in community-authored models of safety and justice. During last week's budget priorities meeting, I know you spoke as a board about the need for innovation and outside-the-box thinking as we move forward in this new budget landscape. This means literally doing things differently, which will take courage, but is the only way forward toward healing your communities who have been betrayed again and again by the status quo. I beg you to use this opportunity not to attempt to wrestle the budget back into how it was, but to act with bravery and foresight to create a truly equitable society. Read Debug's Protect Your People budget and follow its recommendations. Thank you.
Our next speaker is Christina Yee. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. This is Christina Yee with Breakout Prison Outreach and part of the partnership to protect the safety net. Our agency has a few contracts with the various county departments, which allows us to provide critical services to the reentry population in San Jose, as well as the underserved communities in South County. We recently received word that our faith-based reentry resource center contract was cut by almost 15%. Fortunately, we had the resources to fill the gap, but next year may be a different story. That is why it's so important that the county deliver budget-related communications with CBOs in a timely manner to allow us sufficient time for adequate planning. Steps towards transparency, including the universal budget system mentioned in yesterday's meeting by President Chavez, would also assist in these budget-related communications. The reentry population, especially those in South County, receive critical basic needs assistance from our center that will now be affected by the recent cut. I appreciate the board's time and energy to tackle this tough task ahead and now in the.
Our next speaker is Rich Loyola. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Can you guys hear me?
Yes.
My name's Richie Loyola. I'm with Santa Clara County Debug, and I'm one of the co-authors of Protect Your People Budget. To cut the DA's resources that they've been using to overcharge individuals and invest them more into resources that are used to provide strong community-based assistance to those soon to be released, and also to revamp probation and to make it more of a resource rather than being distant, so they can have possibly individuals that can mentor people that are soon to be released who have been through the system and who have positively made it out, so they can guide those other individuals towards a better life. Thank you.
Our next speaker is Catherine Zietzer. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you, first of all, for listening to us, and I just hope that you'll hear us. I support the report, the Project Your People, as I am one of the co-authors of that. It's appalling that you as a board are allowing the conditions to continue in the Santa Clara jail systems. The correctional officers are only wearing their masks 60% of the time. Why has there been another outbreak of COVID-19? Well, as recent as 5 days ago, there was only one sink for 60 men. No sanitizing stations were allowed. When their masks were no longer effective, no masks were available. No social distancing can possibly be adhered to. I have a son that if he was to contract this virus, he would die. I'm urging you to invest more in the jail systems. I ask you, what is your biggest fear if a loved one of yours were incarcerated right now? Please remember why and who you are here for. Thank you.
Our next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
I am speaking now because my comment is more global and not for a specific department. So I just wanted to preface the discussion with broader themes. There is a hunger strike happening right now in our jails. You'll be hearing from some of the family members throughout the day. That strike is absolutely about the budgetary discussion that this county is having today. Budgets are expressions of what a county values and what principles guide them. If we use the hunger strike demands or the Black Lives Matter proclamation that this board unanimously supported as a prism to evaluate budgetary decisions, then decarceration is both the vehicle of how we get through this deficit, as well as how we simultaneously build a more equitable world once we get to the other side. We want to see significant cuts in the DA and the sheriffs in the jails, and we want these cuts to be meaningful, not empty gestures like vacant positions. The roadmap that we have laid out, called the Protect Your People budget, is authored by Santa Clara County families. We hope you read and follow those instructions. Thank you.
Our next speaker is Tina Brown. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Tina Brown. I am a system impact family member, and I am also the mother of an incarcerated loved one who is on a hunger strike in the main jail. I am speaking in support and in solidarity of their demands and request the jail administration meet their demands because there is easy solutions. I also request that the board support the Protect Your People County budget proposal to divest from the district attorney, jail, sheriff, and invest in our communities. These issues impact me because I live in this community with my family, and we are faced with continued systemic racism daily. I have personally experienced and witnessed racial profiling and racial injustices, which specifically target Black and brown minorities, and the end results continue the trauma for all involved with lengthy incarceration or death as a result of police brutality. The practices of Santa Clara County's criminal justice system needs to be changed today.
Our next speaker is Anna Z. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Anna Zeiger, and I'm a member of Surge at Sacred Heart. I live in Santa Clara County, District 5. I'm calling in support of SV Debug and in support of defunding a system that perpetuates violence, harm, and injustice. Silicon Valley Debug proposes significant cuts in the jail, sheriff, DA, and probation. I support the Protect Your People budget. Thank you.
Our next speaker is Leslie Zeiger. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Leslie Zeiger. I'm a member of Surge at Sacred Heart, and I live in Santa Clara County, District 5. I'm calling in support of defunding a system that perpetuates violence, harm, and injustice. Please follow Silicon Valley Debug's proposed budget, the Protect Your People budget. Thank you.
Our next speaker is Michelle Liu. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I'm Michelle Liu, CEO of the Health Trust and a member of the Partnership to Protect the Safety Net. Our local communities most impacted by COVID-19 are the same communities that have been most impacted by the associated economic collapse, predominantly low-income communities of color. We're serving many of these residents through a 3 to 5-fold increase in Meals on Wheels deliveries since the pandemic began. As such, we must maintain our local safety net and commit to making budgetary decisions through a race equity lens to ensure that the next pandemic, economic downturn, or natural disaster does not disproportionately impact these same communities. The Health Trust and our local safety net partners stand ready as advisors to help you shape a budget that meets the needs of our most vulnerable residents. Thank you.
Our next speaker is Jose Valle Debug. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Jose Valle with Silicon Valley Debug. I'm speaking on behalf of our loved ones behind the walls who are currently on a hunger strike on the 5th day. Some individuals have already lost up to 10 pounds. There's been people passing out as well as the hunger strike in itself expanding to the Elmwood, where not only is every barrack in Elmwood on a hunger strike, but also the workers' barracks. The workers' barracks in addition to being on a hunger strike have refused to work. They also provide all the food and labor that's needed in order for a jail to function. I ask that you hear that the jail administration and those who have power within our elected system adhere to their demands, as well as the Protect Your People proposal. Appreciate it. Thank you.
Our next speaker is Charisse Domingo. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
My name is Charisse Domingo, and I'm with Silicon Valley Debug. I'm a mother, a wife, an organizer, an immigrant, and a tenant here in our community. I've been organizing with and supporting families who lost loved ones to police violence and families who have loved ones in the jails and juvenile halls facing charges in the courts. We urge you to adopt the Protect Your People budget, to divest from the criminal punishment system and invest in community-led models of safety, restoration, and justice. This budget is the expression of the county's Black Lives Matter resolution and the declaration of racism as a public health crisis. As you think about the budget, we urge you to preserve the proposed cuts to the DA, sheriff, and jails and probation, and go even further. We urge you to continue to prioritize decarceration efforts, such as eliminating the jail, emptying these institutions of our family members, and investing in community efforts of alternatives to police and housing. Thank you.
Our next speaker is Noah Alvarez. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Noah,
hello, my name is, can you hear me?
Yes. Go ahead. Noah?
My name is the Warden. I am the wife of Dylan Warden, who is on a hunger strike today at the San Jose main jail. Today is the 5th day. I just want to let you all know that he is starving right now. In this very moment, starving to death, I'm sure. He is doing this because of the injustices that he faces daily. Just about every day inside those jail walls, his rights are not being respected. My husband is part of a justice system that oppresses, and that is also a form of family separation. I am requesting that the board support the Protect Your People County budget proposal to divest from the DA, gang enhancements, 3 strikes, LWOP, jail sheriffs, and invest in
Our next speaker is Pamela Emanuel. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Pamela Emanuel, and I'm in support of loved ones that I have who are incarcerated. I believe that we need to value the wants of our loved ones who are inside. And you all say you want change of the incarceration of the system. And I believe that we need to be listening to the people who are speaking. We need to be taking the hunger strike seriously and valuing their wants and needs. My mother, who was recently released, is dealing with her own numerous traumatic, changes because of how she was treated while incarcerated. And instead of leaving so many people traumatized, I believe that we need to prevent this by investing money into alternatives. I believe that DBUG's Protect Your People budget, authored by the families who are incarcerated, embodies all of that. And I just hope that you guys hear us and are compassionate about our wants and needs. Thank you.
Our next speaker is Jay Martinez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Jay Martinez, please accept the unmute. Okay, we'll come back to Jay. Our next speaker is Jen Meyer. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Jen Meyer, and I'm a member of Surge at Sacred Heart, and I teach at one of our local community colleges. Hundreds of people have shared their experiences with you over these last months, and frankly over years now, of how the structures of policing lead to direct and ongoing harm and trauma. The people of Santa Clara County have been engaging in ongoing protests about the ways in which institutionalized racism has weaponized policing against communities of color, both historically and still today. What does democracy mean if our elected officials do not change their policy decisions after this public outcry? Budgets reflect values. We are asking you to value the lives of our Black and Brown neighbors. We are demanding that Santa Clara County divest from the criminal punishment system and to invest in community services. We support the Protect Your People budget for Santa Clara County and ask you to take seriously the humane and equitable vision represented there. Thank you.
Our next speaker is Erin O'Brien. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Erin O'Brien from Community Solutions.
We are at a unique moment in our history, a moment when we have the opportunity to right foundational inequities that are built into our criminal punishment system, inequities that have become so obvious that they are now impossible to ignore. I am proud of our county's leadership for acknowledging racism as a public health crisis and committing to look at governance and budgeting through a racial equity lens. But now what? Now is the time for decisions that provide direction, decisions that address inequities, rebuild the foundation, and create a system for justice. Decisions about disinvestment and reinvestment. Your decisions must provide direction for a justice system that aligns with our values and values all of our communities. The Protect Your People budget brought forth by DBUG is a good place to start. These are times that call for courage, the courage to stand up and speak the difficult truths and to make decisions that will put us on a path to righteousness. As we go through the budget process, let our shared value of justice for all inform your decisions and our path.
Our next speaker is Ebony Holmes. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Ebony Holmes, and I am calling as a co-author for the Protect Your People budget with Silicon Valley DBUG. I'm calling on behalf of my husband, Hector Leanos, who's currently in Elmwood right now doing a hunger strike that has been going on for the last couple of days. In addition to the hunger strike, they're also not receiving their commissary, that they're also not getting. Also, please listen to the demands of the budget, of the conditions that are inside the jail that I see firsthand, rat feces, officers not wearing their masks to protect it. The people in there as well as themselves. So I ask that you please listen to the budget that we have put together, the proposal that we have put together. Thank you.
Our next speaker is Andrew. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hey everyone, my name is Andrew Bigelow. I'm a organizer with Silicon Valley DBUG. I'm born and raised in Eastside San Jose, but I'm now a resident in District 4. I'm urging you all to adopt the Protect Your People budget, and also just want to ground it in that this is not like a theoretical or academic conversation, and the conversation and this push to decarcerate and to eliminate the criminal punishment system is rooted in the generational pain that folks have experienced at the hands of the system, at the DA's office, at the sheriff's office, Department of Corrections and Probation. I'm urging you all to continue to defund them and to divest from them for the families and the people that you represent who have been deeply affected by them and have received harm from them.
Our next speaker is Naralee Campos. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
My name is Naralee Campos, an organizer with Silicon Valley DBUG. I'm calling in support of the Protect Your People budget. I strongly urge you to divest from the district attorney's office, the sheriffs, and the jail, and invest more into our communities. I also urge you to listen to our loved ones inside the county jail who are currently on a hunger strike. Please listen to their demands about all the injustices that are going on inside there right now. Thank you.
Our next speaker is Norma Cuevas. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Norma. My son is in the main jail right now at this time, and he is one of those that lost 10 pounds since the hunger strike started. Hopefully this will get resolved soon. I am here to support their demands. For me as a mother, I really worry so much for him. I really wish this all could have been avoided if both parties expressed their concerns and met in the middle with an agreement that satisfied both sides. This issue impacts me because I know that this is not only affecting him physically, but mentally as well. Thank you.
Our next speaker is Benet Vihar. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Bené Vehar with Silicon Valley Debug. I'm a community organizer. In 2015, my husband led the hunger strike out of Santa Clara County, and which created the consent decree. So today I'm asking once again that you please listen to the folks inside and have some compassion. We've been fighting this for a long time through all these years with very little change. I'm asking that the sheriff signs the Oakland district attorney. The district attorney needs to really stop the lip service and actually do what he says he's going to do with bend the arc. We're just asking that please take a closer look at everything and look from the community side of what impacted communities see. Thank you.
Our next speaker is Jay Martinez. Jay, I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, good afternoon. My name is Juanita Martinez, and I'm here in support and to be the voice for my husband, Martin Martinez. He's currently participating in the hunger strike. I seen him this morning. He's lost at least 11, 12 pounds. I'm asking that I'm in the board support to protect your people, the county budget proposal to buy advance from the DA, gang enhancements, 3 strikes, LWOPs, jail, and the sheriff and invest in our communities. This is not, it's horrible to see them in the conditions that they're in, and they try to have a high spirit and be positive, but they want change, and we deserve it. All of us deserve it. We need our loved ones home and safe and away from this, also from COVID. Thank you.
Our next speaker is Lita Negretti. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Lita Negretti, and I have 2 sons incarcerated in Santa Clara County Jail that are participating in this hunger strike. And I just got off the phone with one of them, and it's heartbreaking. Not only are they losing weight, but one was throwing up blood and passed out, and they had to take him out. I hope you guys do this protect your people budget and move forward and protect them in there from the system with all the unnecessary gang enhancements, the DA's not honoring 1437s, a lot of injustice and racial things that do go on behind the walls. I have served 7 years in prison, so I'm not new to all this, and I hope things change. They change for a minute and then they go back to how they were. Thank you.
I'm going to ask the staff to call on the last speaker.
Pamela already spoke.
Thank you.
Bené already spoke. Cynthia has not spoken on this side. Okay.
If we'll take the only speaker who hasn't spoken on this item, and then we'll wrap up this section. Thank you.
Looks like Cynthia wanted a different item, so we are finished.
Great, thank you for that. So we're going to move back to the board action. We'll go to item 61. And Mike, before you weigh in on how we proceed, I want to let the staff give an update and an overview. I'm going to make a recommendation about how we can proceed, and then I'll come to you for any enhancements or strategies you want to encourage.
Thank you.
So may I go to the staff on item 61 to receive new or updated information they'd like to share with the board?
Yes, President Chavez, this is Greg Etruria, and attached to this agenda item is one report regarding additional information regarding behavioral health services. We're in process of also we had some technical challenges today. We're also in process of attaching a report that's a recap of yesterday's referrals and new information and new adjustments based on what was discussed yesterday with the board. And we're running late because of those technical difficulties. We anticipate they'll get attached this afternoon. as well as one additional referral response aimed at for this item is a response from the sheriff's office to a question yesterday that the board posed regarding the hunger strike. That is in process as well. I believe emails have gone out to individual offices, and we're expecting any moment now for that to get posted to the agenda. So with that update, I don't know if the board wants to wait until later in the agenda until those get attached, or if the board wants to take some other action. But that's kind of the latest, again, these technical challenges we had today.
Thank you. And I just attach them as soon as possible. And then I would just recommend you email the board to let them know that they're available and their staffs. And then the second thing that I just want to highlight for my colleagues is that I had made a request as we were getting ready for the budget to include all referrals that were outstanding for each of the areas, because I thought it might allow for some more context to any changes we were making. And then the other is, you'll see that we received a piece of information from the June budget. I'd also requested that we have the cuts that were already made. So again, we'd be able to better understand what the impact and implication was for each of the departments. What I'd like to do today is work to take the budget and the agenda and essentially split it in half to begin our discussions with items 62 to 87, then to go to public safety and justice as a distinct body of work. Also, what I wanted to do is I wanted to go section by section, and to, for example, Valley Medical Center is 62 to 69, community health services is 70 to 71, and go through each of them separately. If there are any items that folks would like to put on consent now, the only items I would like to consider are between 62 and 87. And so I'm happy if Supervisor Wasserman, I see you raising your hand.
Yes, ma'am. I only found 2 items today that didn't have any revisions. One was number 87, so I would move approval of that and forwarding to Friday. The only other one was 108, but you drew the line right now at 87?
Yes, and on 87, I'm going to ask to keep that off because I have a question for staff on that item.
Okay, and 101 was the medical examiner, but you want to wait to decide on that till later?
The medical examiner, yes, I was going to leave the medical examiner in the context of the other issues that were being discussed. So yes, I'd like to go to public safety and justice as a chunk. There's a technical term for you, chunk. So just as a way to kind of keep us all on track. What I will do is, so for 62, so what we'll do is we'll still take action by category. So I'm gonna ask for consideration of 62 through 69. I'm gonna turn to the staff to let us know who's gonna be walking us through these sections. And then what I would like to do is request overarching the overarching presentation, and then I'll open it up to my colleagues for comments and questions along any item that falls within that area, and then we can take action. All right, I'm sorry, pardon me, and we'll also take public comment by section.
I'm sorry I interrupted. I was just going to say that Greg Aturia will make the presentations, and we have department heads from health services on the line who can answer specific questions if you would like.
Thank you, that's perfect.
Madam President, would you like to take public comment on item 61? I have one raised hand.
Oh, for item 61, thank you. This would be referencing behavioral health. Go ahead.
The next speaker is Molly McLeod. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Molly McLeod, and I actually had my hand up for before and somehow didn't get called on. I am speaking in favor of the Protect Your People budget. In terms of behavioral health, I became a parent because of the family separation system, otherwise known as CPS. The first mother of my eldest son and I have more in common with one another than just what's different. However, there isn't money invested in keeping families together. there's money invested in strangers like me, white strangers in particular, to raise children. My eldest son is in part of the DA report of Black men that were beaten by police and then charged with resisting arrest. I've spoken before the Blue Ribbon Commission. I've spoken a whole lot. My heart is breaking that this could continue along for other generations. Really, the solutions are not criminalizing and locking people up. They're investing in keeping people together. Support the Protect Your People budget, please.
Thank you.
I have one other speaker. Socorro Montano, I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Great. Hi, my name is Socorro. I'm a community organizer here in San Jose, working with Sacred Heart and the Rapid Response Network. I am in support of the Protect Your People budget. And specifically, I'm urging the Board of Supervisors to reverse its June 23rd vote and restore full funding for immigrant services during its August 2020 budget revision. Immigrants remain the most vulnerable affected by the pandemic, and these cuts undermine services that our communities desperately need. Now more than ever, immigrants should not be asked to bear the brunt of this crisis. When the public outcry is to defund the police, we should be looking at defunding and abolishing our sheriff's department and not furthering raising their funds. We should be giving money directly to our community. Thank you.
Thank you. I'm going to move on to items 62 to 69. I'm going to ask for a presentation. I then will go to public comment. Then I will come back to the board for comments, questions, and action.
President Chavez, this is Greg Ituria. And item number 62 is a county executive revised budget recommendation to transfer a position, a chief psychologist position, the Valley Medical Center, to the Custody Health Services Department. And item number 63 is a revised county executive recommendation for the Valley Medical Center to enhance the county's COVID-19 data analysis capacity. Item number 64 is a county executive revised recommendation relating to the Valley Medical Center to reduce the cost of personnel, including the deletion of 130 vacant positions and the reduction of budget for extra help and overtime. And item number 65 is a revised county executive recommendation to the budget relating to Valley Medical Center to reduce the anticipated budget for anticipated costs of services and supplies, and a total reduction of a little over 24.8 million, and to refer these items to Friday for final determination. Item number 66 is a revised county executive recommendation related to VMC, relating to the addition and deletion of positions, where there's the addition of one clinical audiologist, one assistant nurse manager, and one medical physicist position, offsetting these costs by deleting one pharmacy tech, one radiation therapist position, and one half-time nurse practitioner position, and one half-time health services representative position for a net neutral cost. Item number 67 is the revised budget recommendation for VMC, providing a county grant allocation to support the Roots Community Health Center. Item number 68 is a revised county executive recommendation for VMC related to Assembly Bill AB 109, deleting a medical services social worker 2 and reducing services and supplies in light of reduced funding from public safety realignment revenues. And then item number 69 is a request to consider the county executive's revised recommended budget for VMC, including these adjustments we just mentioned, and referral for final consideration on Friday, August 21st. And at this time, with permission from the president, would also like to invite Paul Lorenz, the CEO for Valley Medical Center, to help respond to a question that the board asked us to bring up during the hearing regarding the ability or challenges of comparing the county's hospital system to other public health hospital systems. So with permission of the president, we'll invite Paul Lorenz to help respond to that request for information.
Thank you.
Thank you, Mr. Ocheri. President Chavez and members of the board. Again, Paul Lorenz, Chief Executive Officer for Valley Medical Center, which is inclusive of O'Connor and St. Louis Hospital. So first of all, let me just say that the effort to compare and characterize your county health system to other health systems throughout the state of California is a difficult one, in large degree because every county is different, and it would take probably a significant amount of time and research county by county to understand how the systems are designed, how they're organized, and actually how they administer and fund the various programs.
Paul, may I interrupt you just to ask a quick question? Was this in response to something I raised yesterday?
I believe, Mr. Ocheri, that it came in part out of the session yesterday, but also in previous discussions that you may have brought forward.
I believe it was in June that the board asked us to be prepared to talk about this during the hearing. And so we've invited Paul to do that.
Thank you. Yeah. Thank you. I just wanted to make sure I understood the genesis of it. So thank you.
Thank you, President Chavez. You know, to a large degree, you know, what I'm trying to respond to and from your referral is really about how public systems are different from county to county, and to compare and to contrast would be difficult, if not impossible. And let me give you some background. First of all, in the state of California, there are 58 counties. And what we do know is that every county is different in how they view and define their obligation under the Welfare Institution Code 17,000. In some counties, as we know, they narrowly define and focus exclusively on serving legal residents. And they do so in meeting the very minimum requirement in serving medically indigent adults. And they do this through a variety of different methods, but all counties are required to have an indigent care program. In Santa Clara County, I think it's safe to say that we define our responsibility under the 17,000 code very broadly. And we have a wide variety of healthcare services and programs in the county. And many of those programs actually serve low-income, undocumented children and adults, which is very unique. Many counties don't have the ability or the will to take on this level of responsibility. As you well know, many of the local decisions that your board makes really is responsible to local needs and priorities. And it is a preference of your board to make sure that we have a system here that takes care of the entire community. The diversity of county program designs and methods to which they meet the Welfare Institution codes, again, is very different and difficult to compare from county to county. I would also add that there are three general methods for which counties provide healthcare services in meeting that obligation of serving the larger community as well as the medically indigent. The three methods that I think your board is aware of, this one is counties are providers. In other words, they have the infrastructure and the capacity to provide healthcare, both inpatient acute care services and outpatient. And then there are counties that choose to be known as payer counties. And in this situation, counties then contract with other organizations and healthcare institutions within their jurisdiction to provide for and meet their obligations under the Welfare Institutions Code. So those are very direct types of relationship with those healthcare entities, and those are known again as payer counties. And then you have hybrid counties, which to a large degree do both. They not only provide some limited healthcare services for the indigent and the general population, but they also, of course, contract to provide for a whole holistic approach. But I use that word holistic loosely because I think we all know that access to healthcare is really determined by the ability of the system in the county to meet the entire needs of the community. And we know that that varies greatly from county to county. Now, in Santa Clara County, I mentioned we're a provider county. And so we provide a vast array of services, including inpatient services. The services that we also provide are complemented by a vast outpatient system. And I think your board is very much aware that we do so because it's a much more effective way of providing healthcare. So we do have a large system that provide outpatient services, ranging from primary care to dental to psychiatric services. And I think the important note here in Santa Clara County is that we take great care with your board's direction to make sure that we meet certain service gaps within the community. But not only do we meet certain service gaps within the community as the needs arise, but your board through the years have established some very well organized systems of care around trauma, around burn care, around rehabilitation services. You also have developed a system to provide and complement the larger healthcare community around oncology care and renal care. And this is really unique in Santa Clara County. I think to a large degree, the diversity and the scope of services that we offer allows us to more readily share and spread the risk amongst the various different service lines. And I say this is because if you go from county to county, you will find that the ability to meet the needs of the public and to address the community-wide healthcare issues vary greatly depending on the capacity of the system to serve those segments of the population. And in many respects, those that are sometimes disenfranchised to access quality healthcare services. In most counties, I think most of those that are involved in healthcare understands that the healthcare industry from region to region varies greatly. The market that we are in, if you were to compare it to another rural county, obviously it's very easily to distinguish because of the population demographics or the economics, the types of industries that exist within each of the counties in the region. And all of that determines the types of healthcare services that are brought to bear within those communities. And what I mean by that are other community hospitals, private hospitals that choose to provide service to those segments of the market. I can tell you in Santa Clara County, a large employer-based economy in terms of the technology industry. And there's a significant presence of Kaiser in the area. So it's very employer-based managed care type of services in our county. You're not going to find the same type of dynamic in other regions of the state to this extent. So the industry within each of the regions is very different. And when public systems look to fill particular needs in those communities, they are looking to fill gaps so that they can limit their risk or exposure. In Santa Clara County, and what I can share with you also is that there's a good complement between the various types of systems out there, between the Kaiser system, Stanford, and even the for-profit hospitals such as HCA, where we have carved out a segment of the market to provide for a much more comprehensive service to the community. And this would not be possible if the public system here in Santa Clara County did not choose to take on and serve the vast majority of the Medi-Cal, the indigent. And today we're actually seeing a greater proportion of individuals that are on Medicare that are having difficulty in accessing healthcare. So this system, your public system, complements other health systems in the county, unlike other jurisdictions or counties. And the final comment I would have is that given the way in which we're structured, our funding is very different than other counties. And it is, I think, different if you go from county to county. In our county, I think it's clearly understood that we're kind of a hybrid model. We take risk where we take a capitation payment to care for a certain segment of the population. And as you well know, the vast majority of that is related to Medi-Cal. And in Santa Clara County, we have a two-plan model for which we are a major player, in which we receive that type of reimbursement. That's not the same in other counties. So it's important to note that the reimbursement scheme and the way in which we fund our system is really different than what you would find in other counties. So I'm going to stop there. I probably can go into much more details, but I'm more than happy to answer any specific questions. But the takeaway is that it is very difficult when you try to look at a public system here in Santa Clara County, in our system, if you will, and compare us to other systems throughout the state of California.
Thank you. I'm gonna move on to my colleagues to see, I'm sorry, first I'm gonna look to see if there are any public speakers on this item. And these are items 62 through 69. Seeing no public speakers on this item, I'm gonna turn to the board for comments, questions, I'm sorry, we do have one public speaker. And this is for items 62 through 69. Thank you.
Our next speaker is Mila Romero. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, Board of Supervisors. I come before you after listening to this important message about the budget and funding the medical systems. The public and the community really needs you right now. The children really need you right now. Behavioral health, healthcare services such as CCS, child care, children's services, 4C service. There's a lot of services that are needed, especially in healthcare. Being an authorization representative that would work in the hematology oncology department, in which I did Bass Center for Lucille Packard, Stanford. When I worked there, we utilized CCS a lot because CCS helped pay for the cancer treatment needed from the medication and the care. Those places need to be funded to continue helping the children that need this health care. Those services should be really reviewed to see if a cut is necessary. The services are needed.
Our next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm calling in to support the Behavioral Health Contractors Association's submission of a plan to have non-police responses to mental health crises. The network of organizations and service providers worked diligently to draft that report. They evaluated the different national models and saw what would translate here in Santa Clara County. And most importantly, they met with our families here in Santa Clara County that had lost loved ones to police violence. When family members call 911 for a mental health check or just a welfare check. And to know that we're in a moment where we can solve the issue of police violence and police killings by having a different response that is county and community supported, I think is a road forward. So I'd urge this county to support their proposal and so that we could save lives and also save this county a lot of resources as people wouldn't have to go to jail if they survive a beating and be incarcerated.
I'm going to now turn to the board. I'm sorry. I'm going to take these last two speakers, and then Anna will be our last speaker on this item.
Thank you. Our next speaker is Sharon Watkins. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Sharon Watkins. I am one of families that has been directly impacted by police violence, and I am calling to express support for having non-police response to 911 calls. Because I believe that in the situation with my son, had the CIT officer gotten there earlier, or had there been someone there that was experienced with dealing with a person that was having a mental breakdown, I believe that he would have survived that moment instead of losing his life on that day. And I do not want to have other families suffer like that. That is a suffering that happened 5 years ago. It still impacts our family today, and I have no reason to believe that it's going to stop. So that is all I have to say.
Our next speaker is Anna Fernandez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Anna Fernandez, Hope Services Mental Health Department. I would like to comment on police response to the special population that we serve, and this is the one with autism, developmental disability, and mental illness. This is a very challenging population when in crisis. The crisis response needs to be based on clinical needs, crisis de-escalation, and safety for the all people involved. This population will be better served with a community-based response rather with a standard police response. Thanks for considering alternative community-based models to handle these 911 phone calls. Thank you.
I want to thank all the public speakers, and also to say we're sorry for your loss to Sharon, who called in. Thank you for sharing your story and your experiences. We're going to now go to item 60. We're going to stay with item 62 to 69. I'm going to start with Dave, go to Susan, then Joe, then Mike, to see if there are any comments in this area or concerns. Supervisor Cortese?
Thanks, President Chavez. I understand, I'm pretty clear on all these items, but I do have a question on 67 on the Roots Clinic. It's really a question for Dr. Smith because I think it's more of an overarching kind of philosophical question here. I'm understanding that the $1 million in one-time funding is primarily operational support, which we have some history of doing with the Roots Clinic. And have always been very supportive of that investment. But recently the board adopted the resolution declaring racism as a public health crisis. And it strikes me, not only strikes me, but it's been brought to my attention. I know it's been brought to Supervisor Chavez's attention that, implementing that on the actual health side should probably be leveraging help from the Roots Clinic, and should probably be informed by the Roots Clinic, given it's one of the major footholds we have institutionally in our system, particularly with respect to the African American community, which is predominantly served by Roots, even though it's multicultural. So with that setup, Dr. Smith, what I'm really wondering from a budgetary context is, we go ahead with this $1 million. We want to come back later in the year with implementation strategies around the racism issue. Are we going to be able to, essentially leverage this relationship, for lack of a better word, to deal with these broader issues that we have with systemic racism?
Great question, Supervisor. As you're quite well aware, and the rest of the board, we have supported Roots with $1 million base budget allocation that we've structured as one time for actually a few years now. And the reason we're recommending ongoing or continued support this year is because, exactly as you say, there is considerable concern in the community putting words into action regarding what the board has already accepted, equity commitment and our commitment to the African American population. We didn't put it in as an ongoing allocation because the board has previously asked us to be careful about that. In addition to the $1 million, Roots does also collect patient care revenues. But if the board so desires, we certainly could make it an ongoing expenditure.
Well, maybe through the chair, maybe that's a discussion to come later. Maybe you can just take the inquiry as sort of a budget, an off the dais request for information on what strategies we might put in place, including converting this to an ongoing investment at some point. I think that would certainly be a start in the right direction. It's hard to build an undoing of a systemic problem of any kind, including racism, with a one-off investment. So I appreciate your comments in that regard. But I don't think we need to decide that today. I think I wanted to put a placeholder on that issue to make sure that we don't feel like we came back later and bound ourselves to, any kind of a maximum investment in this regard, with regard to Roots. So I think that's been accomplished by this question and answer. I'm happy with your response, but if you and Mr. Ituria feel like it's comfortable or appropriate to come back before adoption with any further information on your thinking on that, I think that would be good for the board to have before we wrap up the budget. Thank you.
Thank you.
Susan?
Thank you. Supervisor Cortese, I agree with you, and that is a precise example of the reason that Supervisor Simidian and I brought forward our referral on the intersection of health and racial equity. And I think a very appropriate place, if you're willing to send that, is to the committee as we start to look at where these nexuses are and how we can implement new strategies that are ongoing and not one-off. So I really appreciate you bringing that up, and would certainly support it when the time arises. I don't have specific issues with 62 to 69, but I want to just kind of set up as a theme here today, since we're talking about both the health and the justice system issues today, and how we reimagine the justice system and some of the work that's been developing in conversation with community partners in this area. I'll say generally right now that strategies around divestment in some of our punitive systems also have to rely on investment in preventative systems like those in our behavioral health department and custody health systems. And I'm concerned about the level of cuts proposed in these departments, and want to see, as the day goes on, how we can build in some flexibility for these departments to continue community conversations and build new resources, or at the very least maintain existing resources over the course of the fiscal year. So I don't have an ask right now. I just wanted to tee that up because it's going to come up thematically as the day goes forward. Thank you.
Thank you, Susan. Joe?
No comments, Madam Chair. Thank you.
Mike?
No, ma'am. No comments either.
Thank you. I want to raise just 3 issues. One, I really want to reinforce the point that Supervisors Cortese and Ellenberg raised around how we address the ongoing issues of the Roots Clinic. And also, I mean, this fits into work we're doing, relative to the VASC and other areas where we're looking at creating investments that I would highlight as being investments really focused on both prevention and equity. One of my concerns is that throughout the budget, we see reductions in AB 109 work. And what I am really struggling with as I look at this this day is recognizing that the state's making a reduction in their AB 109 contributions, but our goals in terms of having people not recidivate and launch out of our systems in a way that doesn't have them coming back into custody is really pretty critical. And so in this instance, I'm very interested in better understanding the strategy behind the reduction in our AB 109 investment, especially given that we have been so focused on limiting the number of people who are in custody, which I think is the right thing to do, but unclear to me how these two actions align. Dr. Smith?
Yeah, I wanted to try to explain a little bit. When the state reduced the funding, we obviously had to recognize that. But what also happened roughly at the same time is that the state has now changed the model for behavioral health in all counties. So it will function more like a health maintenance organization. So we're in the process right now of creating a partnership between VHP and our behavioral health department to operate more explicitly like a health plan. That will enable us to draw down more Medi-Cal funding for behavioral health. So what we're envisioning is not giving up on the services that were provided by the AB 109 funding, but trying to utilize Medi-Cal funding. That being said, that whole process is not complete, so we could not substitute it into this budget, but I expect that it will be coming in November or February. I agree, we're totally committed to continuing the services. We just need to recognize that AB 109 will no longer pay for them.
In that instance, then why would we delete the code? Why not just leave the code and recognize that there will be a new funding stream in November?
Only because the code's not filled and it's funded, so it helps us balance our budget, and it doesn't have a revenue source right now.
And President Chavez, this is Greg Couturier, if I may well too. We also are working with the departments to find, ways to keep those services and the employees in those codes in the system, so they can continue to provide. The effective date for the positions that have been funded by AB 109, where that funding has gone away, but the position is still filled. We are proposing an effective date that's delayed until December 27th. That provides us time to work with these new potential funding sources, as Dr. Smith described, so we can come back in the November actions and propose alternative funding sources. Because
I'm just going to say again,
so the transition.
Yeah, I appreciate this. This goes back to the discussion that we had yesterday around how we build enough flexibility into the organization to be both opportunistic and aligned with, being mission aligned. And, I will honestly say it makes no sense to me to delete the code. If we were just going to take the savings and you freeze the code, then it gives you the opportunity to unfreeze it or to use another tool besides the delete and add process, which I know you said yesterday wasn't cumbersome, but I haven't had anybody in our organization besides you all tell me that. So it remains a concern. And then the other thing I would just say is that the background information that we're getting now, which I find very helpful, was not reflected in the documents that were given to us. So I don't have any way of knowing the implications of this relative to what you just said in terms of new funding sources, and as it relates to other programs that we have within the hospital, such as the Triumph. I forgot what the anti-gang work that that our medical social workers are doing. So I do appreciate receiving the information now, but given the direction that we're trying to take in these kind of broader policy areas, you know, that really doesn't make a whole lot of sense to me. Let me just close my comments by saying to Paul and to St. Louise and O'Connor and VMC, just how much I really overall want to say how much I appreciate the work that's being done within our healthcare institutions right now. It's really amazing how folks have stepped up, and your ability to fight COVID, try to stay mission aligned as much as possible, and then also to find the resources within your budget to share them back with the organization is just really, you know, it's commendable and deeply appreciated. Dr. Smith?
I just wanted to join in on your compliments and add a little bit to Paul's commentary. Paul and the entire team at VMC, O'Connor, and St. Louise have been really phenomenal. It's hard to imagine that it's really been less than 2 years, and they've really turned the organizations around and done a great job. And as I said before, they came up with a reduction scheme that is larger than we thought they could without reducing costs. There are only 12 counties in the state that have hospital systems and clinics together. We're the second largest, second only to LA, which is monstrous, as we know, but has a relatively smaller clinic setting, so they're not so focused on outpatient services. And some of the health or hospital systems are organized as enterprise funds, some are not organized as enterprise funds, some are very small, some are quite large, some have clinics associated with them, some use community clinic structures which are separate to provide outpatient care. I think we're the only one who has a really comprehensive approach, which is totally credited to the Board of Supervisors for having a very thoughtful and prescient approach a number of years ago and ongoing to make sure we have a comprehensive system of preventative and ongoing care. So I think you have a lot to be proud of with our organization. Thank you.
Thank you. And many, many boards before us protecting that healthcare system. And to you, Dr. Smith, and your staff. With that, I'm going to turn to Supervisor Wasserman.
Thank you, Madam President. I'll make a motion to approve 62 through 69, along with moving them to Friday.
Thank you so much. We have a motion. Do we have a second?
Second.
We have a motion and a second. I will not be supporting the motion as I do not support 68 being moved. And I had the same problem yesterday with a couple, but I'm gonna not support this moving forward. So we have a motion and a second. Is there any other discussion on the motion? Seeing none, may I get a roll call vote?
Supervisor Ellenberg?
Yes.
Supervisor Semidian?
Semidian, aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Yes.
President Chavez?
No.
Thank you.
Thank you. We're going to move to item 70 and 71, and this is our community health services. So I'll let folks know if they want to speak on items 70 or 71, this would be the time to do that. I will turn to staff for a presentation.
Okay, for item number 70, actually even before item number 70, just to point out that item number 61, the 2 missing attachments are now posted. Everyone should be able to see them on the agenda online. So item number 70 is a request to consider a revised budget recommendation for the Community Health Services Department related to reducing appropriation for services and supplies by $400,000. And item number 71 is to consider the county executive's revised recommended budget for the Community Health Services Department as a whole, and to refer the item for final consideration and approval on Friday.
Thank you. If there are any public speakers, I'm going to give them a moment to sign up now. We'll now go to our public speakers. Then I will come back to the board for comments and action.
Our first speaker is Dolores Alvarado. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, members of the board. This is Dolores Alvarado. And on behalf of Community Health Partnerships Board of Directors, I'm respectfully requesting that you restore the proposed $400,000 cut to community clinic funding. It was certainly disheartening to learn of the cut this last Friday. This lack of communication failed to demonstrate good faith to engage CHB and our members in designing solutions. We are essential partners and we're also part of VMC's outpatient system of care, yet the proposed cut sends a distinctly different message. We're not blind to the realities of the magnitude of diminishing revenue, and we want to help you come up with solutions that are well grounded in health disparities data, as you spoke to a little bit earlier, and social justice principles. Please prioritize safety net healthcare services now by not cutting the $400,000. Instead, engage our safety net system of care in serious dialogue.
Our next speaker is Raimundo Espinoza. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. This is Raimundo Espinoza with Gardner Health Services. I'm echoing what Dolores just said. Hopefully you make your decisions again, as we promoted racial equity. We're providing the services to the most disenfranchised community, and that's the undocumented. We serve 10,000 uninsured. The funding that you're seeking to cut, from what we understand to the best of our ability, is for the uninsured, although in the transmittal it points to the Medi-Cal population, which is a totally different population that's funded through Medi-Cal, which helps support the county by reducing access to high expensive services like in the emergency room. So again, this is for the uninsured. We need the money. We've already we've had to cut because of COVID, and we're just barely stabilizing, and this will devastate us even further.
Our next speaker is Sarita Kohli. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you for this opportunity, supervisors. And I just want to echo what Raimundo and Dolores have said before me. Santa Clara County has a long history of protecting the undocumented, the immigrants, the poor. And during this crisis, they have been the ones that are hardest hit. Our clinics in the east side of San Jose have seen and heard, and we know from the statistics that have been presented that it is the people that already didn't have much. And these are people that are connected to our community health centers. We are right there communicating with them and providing services to all of the undocumented, and this cut will devastate our system. So I hope that you will take that into consideration as you make your final decisions around this. Thank you.
Our next speaker is Mila Romero. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. I would like to speak on the topic. It's important that we don't cut any funding because, again, we're approaching the winter and the fall, and that's when colds come out. That's when the flu comes out. That's when COVID is still going to be here. And when you cut funding for healthcare workers and healthcare persons who are providing services to the community, it becomes a burnout on the good people that you do have left. And then they're unable to care for the people and treat them accordingly. And then the plan for discharge, treatment, and follow-up care is very much so needed. People really need you guys right now. They really need you to rethink this before you go through with this, because we cut it now, but we're going to need it when the time hits. So please don't make any cuts, not in healthcare. Everybody is depending on you, including the undocumented persons who are taking care of our lawns and taking care of our house cleaning and taking care of, jobs that people don't want to accept at this time.
So we have no other public speakers. I'm now going to move to Supervisor Cortese.
I have nothing to add, President Chavez. Thank you.
All right. Supervisor Ellenberg.
Thanks. I don't have comments on 70 and 71.
Thank you. Supervisor Simitian or Mike?
I'm happy to offer a motion if you would like a motion on the item, and if you'd like me to wait until both supervisor ready to go.
Yes, go ahead.
Thank you. I'm going to, on the one hand, on the other hand, this one, Madam Chair, on the one hand, I think we do need to find the savings. On the other hand, I am concerned about the lack of ability on short notice to manage the recommended cut. And look, we're going to have to move quickly as we go through this process, but we're also going to have to move with cooperation, collaboration with our partners, all of which is a preface to me saying I'd like to simply move that we take this matter up at the mid-year budget discussion, which I believe is scheduled for February, and consider it then. That way, folks who are asking us to hang on to the funds will understand that we really do need to make some progress on this front, but there'll be more time to manage and transition and frankly to get the clarity about what the impacts would or won't be. So my motion is to continue the item to our meeting in February, understanding that doesn't, quote, address the issue. It just means we're going to try and give it a little more time to simmer. Thank you.
We have a motion. Do we have a second?
Second that.
Supervisor Wasserman, would you like to speak on this item?
I'm sorry, no, she seconded it. I'm fine.
Okay, great. I'm gonna not support that. I think this is money we shouldn't take out of the budget, and I see that we're both contributing on the same agenda to the Roots Clinic and to expand the API community health programming, which I think we should do. And these clinics are working with the people who are in highest needs in the zip codes that we are talking about right now, suffering from COVID-19. So I will be a no vote. So we have a motion. I'm sorry.
Madam President, I just wanted to clarify, if I may, these are vacant positions, not service reductions.
This is item 7. This is the health clinic contract. It's a $400,000 reduction to the clinic contract.
We're talking about 70 and 71?
That's correct.
Okay.
Madam Chair.
These are contract reductions to reflect the actual spending rather than the MFO.
Understood. Thank you.
Thank you. Other questions? Yes, Supervisor Simitian.
I just want to clarify, this wasn't a motion to, quote, make the cut mid-year. It was to continue consideration of the item until our mid-year budget. And if you're no vote on that motion, I certainly understand and respect that, Madam Chair, but I was not suggesting that we simply wait 6 months and then act on the item. I was saying let's take the time to understand what's being proposed, what the impacts are, and are there other ways that savings might be achieved in those organizations? I don't know the answers to those questions, which is why I was suggesting the 6 months.
Yeah, and I think the way I'm understanding this is that if the perhaps we should let Dr. Smith or someone weigh in. What I'm confused about, Supervisor Simitian, with your action is whether or not the impacts are essentially the same, in the sense that we're holding money back from the clinics because we wouldn't be making a decision. That's all. I just don't know the answer to that.
No, to be clear, that is not the intent of the motion. We have contracts. The contracts would be honored, and we would
fully funded now.
If funded as they have been at present.
Oh, okay.
And then, as I say, revisit in mid-year when we have a better sense of what the implications are all around. But it would be my expectation that the contracts would be fully funded in the intervening months.
Thank you. That's very helpful. I didn't understand that. Appreciate it.
And that was my understanding and what I was seconding to. I was not approving the cuts.
Got it. Thank you. Joe was just so fancy in his language. All right. So we have a motion and a second. We'll do a roll call vote.
Supervisor Ellenberg,
Yes.
Supervisor Semidion,
Aye.
Supervisor Cortese,
Aye.
Vice President Wasserman,
Wasserman, yes.
President Chavez.
Yes, thank you. Well, now moving to public health. This is items 72 through 75. I'm going to ask for a brief staff presentation. If anybody is calling in to speak on 72 through 75, this would be the time to call in to do that. I'll now go to the staff.
Item number 72 is to consider a revised budget recommendation in public health related to COVID contact tracing. Item number 73 is a revised budget recommendation in public health relating to the implementation of the Healthy Brain Initiative, a grant-funded initiative. Item number 74 is a revised budget recommendation related to public health for the implementation of the Asian and Pacific Islander Community Health Worker Program. And then item number 75 is to consider the recommended budget for public health as a whole, incorporating these recommended adjustments, and to refer to final consideration on Friday. Thank you.
Thank you. And I'm going to now see if we have no public comments on this item. So I will move to the board and see if Supervisor Cortese, do you have any comments or questions in this area?
No comments at this time.
Thank you. Supervisor Ellenberg?
No comments.
Thank you. Supervisor Semidion?
No comments, Madam Chair. Thank you. Supervisor
Wasserman?
No comments.
Thank you. I actually have a question on item 72, and I from the document, I could not understand if this is asking for retroactive delegation, or because I understand our contract with them is about $12 million, and I just wasn't clear on what this was for, what this did from the presentation and the document.
Yeah, well, we'll have to maybe ask the department if there's anything to elaborate on besides what's in the report. The request is for
Actually,
a delegation of authority to.
Yeah, let me just say what's a little confusing about it. It looks like we're adding people to work for the public health department, but through the contract of Haluna. That's what threw me off just a little bit.
I can answer that.
Thank you.
Basically, as the board knows, we've been using Haluna to do training and expansion of our service in CICT. And at this point, we're trying to readjust the correct number of supervisors that we're contracting for with Haluna. And so we are not confident that we have the smallest or appropriate number to do the training. So that's why we're asking for a delegation to make sure that we can change as we need to get the appropriate training for the volunteers and the disaster service workers and the other city employees. So this is not somebody working for the department. This is the contract change with Haluna to make sure that we have the right number of people to do the training, supervision, scheduling, and the like.
Thank you. One of the things, one piece of information that I had been asking about was where we were in our contract. I actually wondered if we would have the opportunity to reduce our contract here only because of the leadership that our own organization is already playing in this area. So this is a little confusing to me because the contract is for $12 million, and we already have within that contract a number of, in fact, I think what we were hiring them for was really to bring these leads together. I understand that we're using a number of leads from our own organization. I would have preferred that there be more discussion within our own organization about how we can support the leadership of this program. So again, I'm a little surprised that we're expanding given that we haven't hired the leads that we need to date.
It's merely a matter of timing. At this point, if we don't expand, we'll have problems because our total numbers of cases are going up and the training is getting more complex. And with the state CalReady system becoming dysfunctional, everybody needs to be retrained. So it would, without these individuals, it would hamper our function.
All right. So with that, do we have a motion for 72, 73, 74, and 75?
So moved.
We have a motion to approve. Do we have a second? A second from Supervisor Ellenberg. And then can we get a roll call vote?
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
I will be a yes on all but 72. All right, we're going to move on to items 76 through 80. And this
Madam
is
President.
custody help. Yes?
Madam President, sorry, I was trying to raise my hand. I would just suggest that we don't need each of the titles read, just to help. I'm seeing a revolving power shutout coming to Santa Clara County, and I don't know when, if that'll affect 70 West Heading, which it looks like you are at. And in the spirit of saving some time, I think that might save some time because we've still got 30 or 40 items to go.
I appreciate that. Thank you very much. And really what we're asking for is and frankly, I think we do see that this is 76 through 80.
Yes.
I don't think that the descriptions are all in our agenda. I think that's right. Is there anything that the staff would like to add that's overarching and or thematic to this section?
Not for me. No, thank you.
All right. So do we have any public speakers on items 76 through 80? We have none. We have one. Okay, we'll go to public speakers 76 through 80. And this is custody health, and this is the add and delete of nurse position. Well, I don't need to read them. We'll let people, Mike's going to say, stop it, Zinni. We're going to let people join us who would like to speak on this item, and we'll go to them now.
Our next speaker is Catherine Zietzer. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I just wanted to make a couple of comments about the deletion of the nurse, the clinical nurse practitioners and the psychiatric nurses. I really feel that I'm going to urge you guys to not do such a thing. As we all know, this is a unique population all to itself, and to take away any medical care, any mental health care from them on any level and not increase it would be detrimental to them. It is detrimental to them as such as, or take my son, for instance, has underlying conditions, and take away them. How is he going to get medical care as quickly as he can if there are less nurses or less, less nurses for him to see, or less doctors? He can barely see a doctor as it is. So I'm urging you, please do not take away any of the positions there. Sorry, I'm a little upset.
That's all right. Thank you.
Our next speaker is Cecilia Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Cecilia, if you could accept the unmute. There we go.
Yeah, sorry. I will skip. I'm actually waiting for the next bulk of items. Sorry.
Thank you. Our next speaker is Jesus Ibanez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Jesus, if you will accept the unmute.
Damn, bro, my bad. So I was in the freaking board of supervisor meeting. I've been just talking and talking, and did they hear? My bad. Okay, all right.
Jesus, did you want to testify? Jesus? All right. Maybe we go to the
Moving
next
on.
person.
Our next speaker is Mila Romero. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
I'd like to thank your Board of Supervisors for all the amazing things that you've done and are about to do. But please, it is very important in this time that we do not cut healthcare personnel. And it's true of what one of the previous speakers said. And with the high demand of everything, everyone's seeing nurses. They need their triage. They're seeing nurse practitioners. It's like a chain of command before you even get to the doctor, unless it's still very important. Then you get to the doctor. These people are very vital people, and the community needs them right now during this pandemic. We have not even gotten to the part that is about to hit right now. Fall and winter, and I keep saying it again. This is the cold season, the flu season, and still in the COVID season. We need these people. Please do not cut them.
Our next speaker is Christine Clifford. I'm unmuting you. Christine Clifford, unfortunately, I'm unable to unmute you because you have an old version of Zoom. That concludes our public speakers.
Thank you very much. We'll now go to the board for comments or questions. I'll start with Supervisor Cortese.
Thank you, President Chavez, turning my video on there. I'm by myself in strong agreement actually with the speaker on item 79. And as I looked at the item ahead of this discussion, I intended to, to question really the cost benefit of saving $171,000 in a program where, it's, I think everything that we've talked about over the recent years in terms of priorities around, continuing to try to move in a direction of appropriate psychiatric services in lieu of enforcement. And here's an opportunity to actually, stay the course and do it. I understand if there are vacant positions that there'd be a temptation to freeze them right now or to not fill them. But again, even in times of relative austerity, we're also in times where we're trying to address a public safety crisis and a mental health crisis, that are sort of calling out to us to go in exactly the opposite direction of this, to keep people out of incarceration, to treat people on a medical platform, a mental health platform rather than an enforcement platform. So Dr. Smith, I don't know if you want to respond to it at all. I know these are probably hard decisions for all of you as well, but I feel like if I vote for 79, I'm supporting the exact opposite of everything I've been asking for the last few years.
Again, this is one where some of these positions are filled and funded by AB 109, and the proposal is to delete the position that's funded by AB 109, move the incumbent into an alternate position of the same type and the same reimbursement. So nobody would be going out the door, but we would have a funding change, which we can do in custody health much easier than we can do in other components of the organization.
So through the chair, are you saying that we would see an offsetting action on the custody health side somewhere in this budget?
The placement of a person in another position doesn't come to the board, it's done administratively.
Okay. Can we get something sort of codified in this budget vote on the 21st that memorializes that in the documents?
Sure, we can give you a rendition of how it will be changed It would be nice if we could just simply say, you know, this position is now funded by XYZ funds, but we have to do it this way where we delete one position and then move the person into another position. But we'll give you that information for all of them.
Yeah, if it can be memorialized in the budget document, that again, I'm gonna make my support vote contingent upon that. You already said you can do that, but just for the record, that's what I'm looking for. Thank you.
All right, Susan?
Thanks. I want to begin by recognizing and thanking Andrew James for his service as interim custody health director during arguably one of the toughest times managing COVID response in the jails. Thank you for your good work there. I'm sure that your team is delighted to have you back at Valley Medical Center. Regarding the cuts and shifts in positions within this budget, I too am very concerned. Custody health services are critical to the health and recovery of individuals that are in our custody. And with the new custody health director beginning just this week, what I would like to recommend is that she provide a report in October to the Health and Hospital Committee on her recommendations for service improvements and staffing recommendations so that they can be captured in the November budget discussions, please.
Is that Susan, is that a motion then to move these items with that addition?
In fact, yes, it is. Thank you.
So we have a motion. Do we have a second? A second from Supervisor Wasserman. Mike, Supervisor Simitian, did you have any comments in this area?
I did not. Thank you, Madam Chair.
Thank you. Supervisor Wasserman, any comments? No? All right. So we have a motion and a second. This is another item I won't be supporting the action. It does feel like the opposite of the direction that we were going in. I remain concerned about, you know, taking away the AB 109 services and I, you know, and frankly, you know, having longer waiting lines for mental health as we're really, you know, it just feels the opposite of the direction we should be going. So I won't be supporting this section. But if we could get a roll call vote, Supervisor Wasserman.
Thank you. If I may make a comment based on what I just heard from you.
Sure.
Thank you. Through you to Dr. Smith, if I may. It was my understanding with the explanation to Supervisor Cortese regarding 79 that the position currently being funded by 109 will be maintained but funded via another source. And it's also my understanding, now that I get the comment correct this time, this is not a loss of people. That's what's the important thing to me here, because my understanding was these budget talks basically are a loss of unfunded positions, shifting of positions, people that are retiring, somebody moving from one spot into that spot. Dr. Smith, through the chair, please, if you could please just confirm that's what's going on here.
You sort of got it right. No people leave. People get moved to a different position. The position gets terminated because it's linked to a budget unit that's funded by a funding source that's going away.
But the people will still be there.
Yes.
Okay, that's it for me, Madam President. Looks like you made
an
additional comment.
For example, if we just ask the board to eliminate the vacant position in the other budget unit, then we have a position that's unfunded. By moving the person into the different position, we have a position that's funded, and we get rid of the vacant position that was funded by AB 109. Hope that is not too confusing.
Yep. Thank you for that clarification.
All right. So we have a motion and a second. No more discussion on the motion. Please, let's get a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simitian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
No.
Thank you.
Thank you. We're moving to item 81 and 82, and this is under, I'm sorry, 81, 82, 83, and 84. This is behavioral health. Are there any overarching comments to this section?
Nothing beyond what's already in your packet.
Thank you. Then what I'm going to do is for 81, 82, 83, and 84, we'll go to public comment, and then we will come back to the board for discussion and action.
Our first speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. I raised the hand up. Sometimes this thing kind of goes back and forth. I don't know. I'm kind of beating up my smarty phone over here. Yeah, I wanted to talk about the previous item. I can just tie it into these other four that we're tackling together. We keep cutting positions. I understand what this is all about. I went through similar situations, not as extreme as this with my own business. You know, I know what has to happen, but where is behavioral health? Where are these social workers, and why is downtown San Jose a psych ward now? Do we have to put people in like special protective gear to go out and interact with this segment of our population? Why is the behavioral health location down there like a ghost town? Why are there people defecating, sleeping in the parking lot, smoking meth, banging on those doors, asking for help? Did everybody go on vacation? Let's figure out some suits that we can put people in that they can get out there and interact if they're too scared to do it, or get the proper advocates to know how to do it. Thank you.
Our next speaker is David Mineta. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. David Mineta. You could accept the unmute, David.
He may not know he's still muted. David, you're muted still. David, you were unmuted for a sec. Try again.
Hi, thank you. Sorry about that. I seem to have the worst problem on this. Sorry. Anyway, thank you. Thank you, Supervisor Chavez. Good afternoon, supervisors and county administration. We often talk about how Santa Clara County is different and leads by example. This current budget deliberations and the decisions that result will provide the clearest proof of our difference, particularly as it relates to anti-racism and equity. Since the murder of George Floyd, the Behavioral Health Contractors Association has been studying community-based crisis response models. One model that is being replicated around the nation is the CAHOOTS model from Eugene, Oregon. This model has been shown effective with a homeless population and is being replicated with the hopes of being equally effective with racial and ethnic communities. Community response is typically staffed by nonprofit personnel, many of whom are peers and from the very communities from which the calls come from. In addition, these two team personnel are staffed by medical professionals. And thank you very much for consideration of this model.
Our next speaker is Bree Moeller. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, members of the board. I'm making this comment in support of the Behavioral Health Contractors Association's community-based model for crisis response. In my work as a patient's rights attorney, I represent people with mental health disabilities. And I've had many clients who, in the middle of a crisis, are criminalized and consequently traumatized by police intervention to their needs. There shouldn't be a criminal response to those experiencing a mental health crisis. There shouldn't be a criminal response to those experiencing substance use disorder. People of color are disproportionately at risk when we uphold a system that favors a criminal response to what clearly necessitates a community health response. So how can the board truly address racism as a public health crisis? Here's a clear opportunity. Invest money in a community-based model for crisis response. The proposal from the Behavioral Health Contractors Association urges you to look at the Mental Health Services Act. Thank you.
Our next speaker is Sparky Harlan. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, Sparky Harlan again, speaking on behalf of our model. Imagine a different way of dealing with these crises we get now. You know, I've heard Scott talk many times about what's happening with homeless. Imagine if we have vans throughout the community identified as outreach workers who police can contact that have instant connection to a homeless person who's having an episode, who needs help, who needs cold water during a heat cycle. Imagine Supervisor Cortese, that person you had that needed help and was told they need to be starving, if instead they had a community member right there saying, how can I help you? Let me try to find you a bed tonight to stay in. We can do this throughout our community. Other cities are joining us and looking at what we're proposing. Let's work together and do things differently for our community. Thank you.
Our next speaker is Elisa Koff-Ginsburg. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I'm Elisa Koff-Ginsburg speaking today on behalf of the Behavioral Health Contractors Association and the Partnership to Protect the Safety Net. As they work directly with vulnerable communities, CBO providers have a unique perspective to bring to discussions of how to minimize the harm of unprecedented budget reductions. Vulnerable residents of Santa Clara County deserve to have all the expertise, whether they're employees of the county or of CBOs, work together to address these unprecedented threats to vital services. We understand these are unusual budget times and the magnitude of revenue is continually shifting. Still, it is possible for behavioral health and other departments to meet with CBO partners to identify strategies to be used depending on the size of reductions needed. Current practice of sharing information and strategies only once decisions have been made eliminates the possibility of input from those working.
Our next speaker is Erin O'Brien. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Erin O'Brien with Community Solutions. Supervisors, I would like for you to imagine for a moment that a loved one of yours is in the midst of a profound and frightening mental health crisis. You are scared for them, scared for yourself, and you don't know what to do. When you think about what you truly need in that moment, I cannot imagine a law enforcement agent with a gun on their hip is what you visualize. Unfortunately, that is the only functional response that we have at this point. You heard today from a family member who called upon the only option she had, and their loved one ended up being killed by the very people who were supposed to help. Law enforcement is fundamentally the wrong response for these and other nonviolent, non-criminal situations. We need specially trained community clinicians and social workers who are expert in de-escalation and support. We must shift away from a law enforcement response. Please implement the recommendations in the collective call to action regarding diverting 911 calls and other behavioral health crisis calls that was submitted to you today. Thank you.
Our next speaker is Cecilia Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, board, and sorry for the mess up earlier. With that same spirit that you talked about custody health, we want you to look at this behavioral health as well. I'm an organizer with Silicon Valley Debug, and throughout the years, we've supported a number of families whose loved ones have had psychotic episodes, and as many have mentioned, the only response has been police. And many of them were lucky enough to only be incarcerated and not shot and killed by the police, such as Sharon's son, who she shared earlier. So we're asking you to not cut any funds from the behavioral health, but instead increase funds, especially for those who are in custody. As we were told by a member of the organization, that when you ask for behavioral support inside custody, the only thing you get is a Zoom consultation with a psychiatrist to ask you if you're going to harm yourself or not. That's not the response we need.
Our next speaker is Molly McLeod. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
My name is Molly McLeod, and I'm speaking in favor of keeping the resources for mental health crises that don't involve guns, that don't involve coercion, that involved respect and the opportunity for each person to connect in community and to be treated with respect And this is the time to be imaginative. This is the time to find solutions. And I believe it's possible with the work that's being done, for example, with the Government Alliance on Race and Equity, and even more important, by the work that's being done by community organizations like Silicon Valley Debug. What would happen if we actually bridge between the insider bureaucratic knowledge, and I'm speaking as a former City of San Jose employee who is retired, and then also connect that to community resources. What an opportunity we have. Grab the moment.
Thank you. I want to thank all of our speakers. Before I go to the board, Dr. Smith has asked to, I see his hand up. I'll go to Dr. Smith and then back to the board for discussion.
Yes, thank you, Madam President. Had a slightly modified recommendation for this group of proposals. In 81, there are 4 contracts. One of them for the Law Foundation was inadvertently placed in there. So the recommendation now is to not defund that. That's a little bit more than $262,000. The other 3, administration considers these to be right sizing the maximum financial obligation. They've all historically come in under expending under their maximum financial obligation. So this is to readjust that to be keep more in keeping with what they actually have used. And we will monitor it as services are ongoing. If they need more, we'll come back to the board for a modification. But we didn't want to leave money allocated not being utilized. For 83, that's the same thing that we've talked about before in AB 109. For 82, I think Sherry is on the phone to be able to give you an explanation of the operational impacts for that if you would like.
Thank you. What I'll do is I'll go to my colleagues, and then if anyone has any questions, thanks Sherry for joining us. I'll go to Supervisor Cortese.
Yes, consistent with my comments on the previous couple of items we were dealing with, I'm having even more so just a lot of difficulty in these direct behavioral health department areas. Unless there's a complete net swap of cost, from one area to another, like in the AB 109 item, I'm just having problems with any kind of cuts, actual cuts or reductions whatsoever in this area. And let me see if I can get my video on here to be a little more sociable here with my video on. I just feel like this is an area that will be expanding in need, and I think it is already. We're on the policy side where some of us are putting together, and I think the board as a whole, putting together support for older adult mental health reconvenings like we haven't had in 4 or 5 years because of isolation, because of problems related to shelter in place, secondary type issues to shelter in place. And then, even before March 17th, we were seeing these problems. We were in an area, again, I don't want to repeat myself from earlier, but where a shift of some kind, whether it be from public safety to mental health or somewhere to mental health, it just seems to me the shift we should be making now, and the time is now. I don't see conceding that kind of transformation of the budget to austerity or to the fact that we have reduced revenues is, I don't want to concede that. I don't think that we should, essentially put the idea of expanding and moving forward and shifting resources on the behavioral health side to expand those programs on the back burner, in the name of budget balancing. There's got to be another way to prioritize than that. And I'm sorry, I think part of the problem with some of what I'm dealing with in terms of thought process is, although we've had an opportunity individually in our offices to, advance, study the budget recommendations, we haven't really had an opportunity, like in all years past that I've been here, to do actual study sessions where we could spend a day talking about these things and really getting a feel for whether or not the board would like you to come back with something else. Come back with something else. We don't seem to have that luxury. And again, I directed to Dr. Smith these comments because if there is a way to do that, by all means, let me know. I suppose we could be using this session a little bit more like a workshop and say, look, come back in November and reconfigure this. When I say we, I'm presupposing there's support on the board for taking a harder look at this section. But for me at least, I'm just not prepared to do this today. So I'll leave it at that. And obviously, I'm interested in hearing from my colleagues.
Supervisor Ellenberg.
Thanks. I'm going to echo much of that. As I stated last week in our priority session, sustaining and even expanding behavioral health services across youth, adult, and justice systems of care are a top priority for me. And this is even more urgent now with the prospect of 19% in cuts to MHSA funds over the next few years, which makes up the largest portion of the behavioral health services budget. Given the health and social and economic demands imposed by COVID-19, it is clear that we need to do more to protect and promote our community's mental health challenges, not less. So I am opposed to any cuts in behavioral health services at this time. I do want to turn to Sherry for just a couple of questions. Thank you so much for joining the call. For item 82, the 9.5 positions not within AB 109, referencing those, how will the department continue to assure client access to services without filling these and any other recommended for cut positions?
Sure. Thank you for your question, Supervisor Ellenberg. I appreciated your comments around the plan or the upcoming declining revenues related to MHSA. That's really pushed our department to try to think strategically about how we move forward related to ensuring that our network is available and adequate to serve the clients that we're required to serve. I think making these adjustments are always difficult. We've had to look at the availability of other vacant codes across our system to continue to support our system. And so these would be, would impact our system. However, we continue to look at the availability of other positions to be able to ensure that services are provided. In terms of our current network adequacy reporting, we're not required to report vacant codes. It's actually filled positions that are currently providing services. And while we're continuing to gather that data that should be available toward the end of this week, we are able to meet the current demand of services that are being required right now. So it will require some shifting and prioritization of resources. Of course, this does have an impact on our service delivery However, we're continuing to look at what available resources we have. Services are provided.
I really appreciate the spunk and attitude around we're going to find something, but truly, this is not an area, given the state of our county, given the priorities set by the board members, given the sort of the dramatic shift in our community. This is not the time to be even having to scramble to figure out how you're going to cover services. I think about a lot of the new programs that Tony Tully stood up just before she left with regard to our unhoused community members. Those have barely had a chance to start working. With regard to the contracts, the proposed reductions for contracts for housing supports, the language is that they're reportedly underutilized. And I'd like to understand why funds would be underutilized when we know the need is there. Is it because our provider partners need more support to be able to expand their reach? And how can we be sure that the proposed cuts wouldn't negatively impact residents or limit access to residents that could be served by these programs? Do you have any insight on why funds would be underutilized?
Sure. So part of the service delivery is actually looking to leverage Medi-Cal as needed for the services that are provided for individuals that are part of these programs. And then there's other services that are not billable to Medi-Cal. So as we look across the contracts for these various services, at the end of the fiscal year, sometimes not all of the funds are expended. And so we continue to work with our providers to maximize opportunities to bill Medi-Cal where possible. However, at the end of the fiscal year, these contracts have gone underutilized. I think what's important going forward would be to continue to partner with the Office of Supportive Housing to consider opportunities to look at services, how we can continue to maximize funds that may be available across our system at large, to really try to increase and improve services and make sure that those are available. And we do, in this time, really want to consider how we can support providers to truly maximize and optimize billing for these services. So I think that would generally be my perspective around these particular programs.
Thanks. Sherry, I really do appreciate that. And I appreciate the efforts you and your team are making to reduce your cost, but I'm just not going to agree that we can cut critical services. I think we heard the same from Supervisor Cortese, so I want to turn, before I finish my comments, to ask Dr. Smith for agreement to revisit the proposals for behavioral health and report back on alternatives. Are there any concerns that you have, Dr. Smith, about doing that?
We can revisit them before Friday and see what we can do.
Thank you. I realize that's quite a tall order in a short amount of time, and it means that something else is going to have to be cut even further. And we'll see what the rest of our colleagues say, but my guess is that you're going to have a big steam train going in this direction. And just want to kind of broadly put this into the context of justice, divestments and reinvestments. I know that there are a number of efforts underway in behavioral health, including in bolstering intensive outpatient services for adults, planning for expanded school mental health services, and perhaps most importantly, looking at how we shift from a law enforcement driven framework to a behavioral health and preventative framework in the justice system. And this budget that you've proposed, Dr. Smith, is shifting away from funding enforcement and confinement resources at past levels, but we can't engage in the true reimagining of a justice system without comparable increases in mental health services as well as other pro-social services. We know we're underfunded already. but our attempts to move to a more engaged pro-social community model will absolutely be thwarted by the lack of these types of services. The Protect Your People budget highlighted today on public comment, I think operationalizes well this vision. So given all of that, I want to turn back again to Dr. Smith and ask for you to lay out your approach to how we would facilitate this shift given the current budget constraints. And I'd like to request a report back with the related funding direction on the bigger picture. And yes?
I'm sorry, that's what I was going to ask. Do you want to, could you clarify that a little bit more?
Yes, so I'm asking for two things. To maintain the current funding right now, not to make cuts in this current budget to the behavioral health services, but also looking at the bigger picture in a slightly longer term lens, using the Protect Your People budget as a model to come back with related funding direction in time for the consideration at our November budget revisit.
Supervisor, I totally sympathize being a physician and a bleeding heart liberal, but we felt this afternoon we have quite a number of cuts on your table for police and DA and probation. And although I agree, I don't like to suggest anything in behavioral health, I didn't feel like we could put more on the table at this point for the DA and the sheriff and probation because we're focused on unfunded positions there. And I did look very carefully at the debug proposal, and it's a very wise proposal, but if we're going to get there, I think we need to get there in steps. So I totally am happy to look at finding something else for behavioral health.
I appreciate that, and I was not directing where those funds should come from. So let me be clear about that, and certainly not over the next few days. And I think Bleeding Heart Liberal was meant to be a compliment. I'll take it as such, but what I want to be really clear about is that this is about protecting the health and safety of every member of our community. And I don't see that as a liberal or a conservative position. I see that as a responsible local government position. We are literally responsible for the health and well-being of 2 million residents of Santa Clara County. The most vulnerable among them needs the most help from us. And that is our core responsibility. That's what we should be doing, regardless of political leanings or bents or affiliation. Right. So I look forward to hearing what you substitute on Friday for the mental health, and then in November, perhaps mapping out a longer term strategy. I fully understand that we can't do all of this in 1 year and that we can't do it necessarily on the backs of just 1 or 2 departments, but I think I've made my point and made my priorities clear.
That was my description of myself, not description of the board or anybody else. I'm proud to call myself a bleeding heart liberal because I do believe in what the county does and what the board does. And I believe in taking care of people who don't have the same opportunities that some of us have. So that was me referring to myself, not anybody else.
Thank you. Supervisor Wasserman, I'm sorry, Supervisor Smidian?
No comments at this time, Madam Chair. Thank you.
Supervisor Wasserman?
Thank you. I'm on board with trying not to make these cuts in these areas, but as Dr. Smith said, we got to find somewhere to do it. I appreciate him saying he'd find a way as far as behavioral health goes. This is just it's a lousy situation. It's a lousy world right now, and so much falls on the county to provide for so many. We can't print money. And so I appreciate what Supervisor Ellenberg said. I appreciate Dr. Smith coming back with some alternatives for us to consider. We talked a lot about November. November is when we won't have any funded vacant positions left basically to cut. You get down to real people. And so that's why in my heart, I hope a miracle happens. I hope things start to turn around. I hope there's a stimulus. I hope there's funding for the state and for the counties. There's got to be something, because there's 2 or 3 passes we have to take at making sure we have a state mandated balanced budget throughout the year. And as stomach wrenching as all of this is, and yesterday was, and tomorrow will be, and this is the easy part. And this is hard. And I just hope between our brilliant administration that we can continue to come up with some creative ideas to help the county provide the services the best it can. We're not looking to expand. We're simply looking to maintain and do what we're doing, and realizing if things continue the way they are, things could get worse. So I'm with what Supervisor Ellenberg said. I'm looking forward to what Dr. Smith brings back, and that's it for me.
So I'd like to just add some comments, and then I'll come to you, Supervisor Cortese. I see your hand up. One is, I will just say to my colleagues that when we took the budget vote in June, my expectation was that these hearings would be more fulsome budget hearings. And actually that was my understanding at the time. I recognize that the pressures on our staff are pretty dramatic in terms of, COVID-19 and the budget cuts, and all that being said, part of the reason that I'm concerned about the way we're using vacant unfunded or vacant funded positions is that some of the vacant funded positions are positions that are hard to fill, that we may in fact, as we think about the future, want the opportunity to fill those over others. I don't mean in the short run, but I do mean that in the long run. I think it's also very challenging to have these conversations based on adds and deletes and not the overall robust approach of each department and what they see coming for themselves and how they want to prioritize. I will just add that part of the reason we had the priority setting session and the timing we did is that during when I became chair of the board, one of the to-dos was this priority setting, and what I'd actually hoped to do was do it in the fall. This was pre-COVID and pre-knowing the challenges we were going to have, but I wanted to do it in the fall because I knew that the following year is when, that we start preparing. Normally our organization prepares for budget in the fall. And I thought that would allow for a very meaningful conversation between the staff and the board in terms of where we saw the county going over the next 3, 4, 5, 10 years. I say all that because, I also have a concern about the approach with behavioral health, and let me just say what mine are. 3 things. One, hard to fill doesn't mean we shouldn't try to fill, and that's partly why I wanted the board to have flexibility. The board and the staff. Second is that as we look at emerging trends and needs, we obviously have a strong need for to continue to invest, for example, in the Law Foundation in a whole number of areas as they're supporting our efforts with COVID-19 as well. And then the other is that, these very important discussions that we're having about the role of behavioral health and mental health are really worth a deep dive. And, the alternative plans that our communities come forward with, albeit today so hard to look at, but the programming and strategy ideas that we're having that are being had are really critical. And in my mind, one of the opportunities we have is to think a lot about and act quickly. So think while we're doing about our approach, for example, with behavioral health and with housing. And Mike, your your impetus to ask the very important question about cost, I think there are a lot of questions that we could ask, which is what gets us the best outcome? What's the most cost-effective way to get there? And then I think one of the things we need to accept is there may be changes in the way our organization needs to function that unfortunately in times of crisis is the exact time to have those conversations, because what I learned from being in the city of San Jose during the downturn is that we made dramatic cuts, and in some instances those cuts were really tied to how we were going to grow back, and almost thinking about it like a rose bush, like you're going to cut, well, I say this like I plant or anything, but like, you know, that you have this approach where you know you're going to prune back because you have an expectation for how things are going to grow back. And I have concerns, and maybe because I don't understand all of the context in terms of the way the staff does, because that's not the way the budget's being approached right now, to understand what that grow back strategy is and what the maintenance strategy is for each of the different areas that we're talking about. And so, for example, I like the idea about us thinking very, very urgently and critically about who responds to what kind of 911 calls, but not just for behavioral health, but for another kind of call. And that is when we have an act of domestic violence or sexual assault, making sure that we have somebody who is trained, who can be on site. Right now, the protocols that we have, we often leave police officers in homes when the alternative to having an advocate or somebody who can help that person may be a way to allow that officer to do other parts of their work. I'll tell you that for behavioral health, in one other area where we are dealing with child protective services, we sometimes have counselors waiting for hours because they can't get a police officer there to be able to write a report. I mean, these are the kinds of things that I would hope we could be diving into. So all that being said, I feel, I share a lot of what Susan's shared, but I actually am interested in how do we branch off so that we're meeting the moment and the new times, and frankly, new ways of thinking in a more constructive way than I think we're able to do, or at least that I feel like we're doing right now. Because I think one of the actions that should be taken is that if the board, based on how the board, irrespective of how the board decides to pursue the budget recommendations, is what are we doing to look at the alternatives to 911, because those all have cost and human capital implications that we're not really able to dive into and digest. So I see Supervisor Cortese's hand up. I'll take Dave and then back to Mike.
Yeah, I really do want to take two turns on the same topic, and so I try to be brief. Let me just say, I was prompted a little bit also by Jeff, I know your really benign comment about you being the bleeding heart liberal. I'm good with that. I'm fine with that, and I'm not picking on you about that. But I want to say that I really want to emphasize that I think this issue is a restructuring issue. It's a business model issue. It's a cost of doing business issue. It's what the cost of doing business on the back end operation is kind of an issue. It's an issue that is more related to the cost study on homelessness that was done a few years ago that informed us that we were spending $521 million a year. I assume we still are, or more. But thanks to Supervisor Wasserman, because he posed the analysis, what would be the value of restructuring our business approach? Not because, as Supervisor Ellenberg said, anyone is Democrat or Republican or liberal or conservative or moderate or anything else, but is there a business model that cuts that back end cost down and still allows us to do the humanitarian work that we need to do on the front end in more of an interventionist kind of a way? Part of that was extraordinarily dependent on mental health investment. We'll remember that those that were identified in that study to be persistently homeless or chronically homeless, essentially, were just under 40% of the population. So it tells us if you want to save $521 million a year on mental health recidivism and the 49% that are in our jails and all that costs, and we're going to need to invest. And we've been trying. We use Measure A and some other resources to try to sort of attack the homeless problem. But now with COVID, we're emptying out our jails, which we know are, at last count, 49% clinically diagnosed with mental health issues. And we're releasing those folks out onto the street. So our constituents are saying, what are you doing about that? And how are you dealing with those issues from a public safety standpoint? And oh, by the way, we don't want them dealt with badges and guns. We want them dealt with mental health services. And at the same time, we separate and apart from that and exacerbated by that, we have a growing homelessness problem, which is evidently going to get worse because the federal government is not passing anything that resembles the HEROES Act. Working Partnerships and others have just told us we got 50,000 people right now that are more than one payment behind on their rent. And if they, some of those folks have existing mental health issues, which would be the norm in society, then we're going to have people with mental health issues exacerbated by having lost their homes. This is coming right up. And at the same time, I get it. Our revenues are declining for all the same COVID-related reasons, but I'm suggesting here that I think what the others have suggested in so many words is we have no choice but sort of walk and chew gum at the same time here. We've got to balance this budget, but we've got to radically shift, holistically shift and restructure how we're doing things. And it's less about do you want to fund police or not, or do you want to fund DA or not? It's about who are we going to have on the streets, literally and figuratively, that are part of our growing safety net population, dramatically growing safety net population as a result of what we've already seen in the last 5 months from this disease, and how much of the kind of healthcare that they need, how much of our public health crisis is going to start showing up on the mental health side now. I think we already know the answer. And I think that's why several of us are saying wrong direction. We've got to shift. And I wish I had the sharp pencil and the paper and the genius to figure out where to shift dollars from one place or another to make that happen while still keeping things in balance. But I just think this is, as overwhelmed as everyone is trying to get a budget for us to adopt here in the next few days, and how much work it is. I don't diminish that at all. I also can't walk away from this issue, and so somehow it's got to be resolved, even if it's by some significant kind of a placeholder in the budget that allows us to keep working on this after the end of the month, and maybe that's the way to do it. That's the only real concrete suggestion I have, to set up a contingency reserve, for mental health growth that presupposes that we will take dollars away from other places in the budget on an ongoing basis. I don't know if there's an appetite to go that far with 3 votes on this Board of Supervisors, but I'm certainly up for that kind of radical change right now. Thank you.
Thank you, Dave. Mike?
Thank you. It's, you look at our mission statement, you can interpret that so many different ways. Us being in charge of public health and public safety. I remember 10 years ago during the Great Recession, it was either the governor of Oregon or Washington, I forget which of the two. And he took his budget and he had the people prioritize what was most important to them and assigned a dollar amount to each one. And when that dollar amount equaled his budget, he drew a red line and said, okay, we will discontinue everything else. And I know some people like that, some people didn't like that. The other alternative is that you do things evenly to all departments. And some people like that, and some people didn't like that. What I think is very important for us all to acknowledge today, all this consternation, anxiety, and angst that we're going through right now, we're dealing with 30% or a third of our projected deficit. That's all we're doing here. We have this is the tip of the iceberg. And we have many more difficult conversations and decisions ahead of us. And is it we discontinue some services somewhere? Is it we reduce them all equally? I remember 10 years ago, Supervisor Chavez, all of our employees voted to take a % reduction across everybody instead of letting certain people go who were last ones hired. There are so many different ways to get to where we have to go, and none of them is comfortable. None of them is happy. And I don't know where we're going to get to go, but these conversations we're having, these frank conversations we're having during these meetings are so very, very important for our administration to hear. What are priorities and concerns to us? Because, you know, we're talking behavioral health right now, and there's the whole public health department that's dealing with COVID. There's public safety. There's those items, like I said before, that only the county can provide. That nobody else is going to open a jail. There's these things, and we have many difficult decisions. And I'm glad I'm on the team with these supervisors and this administration to make the best decisions we can. But what we're dealing with right now is only a third of the known problem. And we need to all be open-minded to what solutions and how we proceed. And no one is going to escape, you know, being reduced in some manner or another. And I just wanted to get that out there. This is not balancing our budget for the year today. So anybody in the public who's listening, this isn't doing it. This is the first. And our next meeting, I believe, Madam President, is November. Is that the next scheduled? Yeah.
Yes.
Okay. Thank you very much.
Thank you. I'm going to go back to the board. So we have 81, 82, 83, and 84. And the question really here is we need a motion, and either it's a motion to move all of, you know, to accept the staff's recommendation and move it to Friday, to not accept the staff's recommendation, or to give an alternative. So I would like to get a motion from my colleagues.
I would move that we reject the staff's recommendation and direct them to come back with an alternative recommendation on Friday.
So we have a motion. We have a second. Is there any more discussion on the motion? Seeing none, I'm going to ask for a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
Yes.
Thank you.
Thank you. We're going to go to items 85 and 86, and this is to reduce services and supplies for the emergency medical services, and 86 is to refer this item to the budget on Friday. And are there any overarching comments that would like to be made? Anybody would, I'm sorry, that the staff would like to make?
Nothing in addition to what's in the packet.
Thank you so much. And then I'll go to the board to see if there are any comments or questions. I have no speakers on this item. Any comments and questions from my colleagues?
I'll make a motion.
We have a motion. Can we get a second? We have a motion and a second. Are there any other comments? I actually just wanted to ask a question, and I apologize. I'm not sure if this is to Supervisor, I'm sorry, to Dr. Smith or to Jackie, but I was wondering when are we going to have an RFP or an RFQ for this body of work?
We are still working on that. We're discussing our options, and we'll be getting back to the board with an off agenda within the next 2 months.
What I'm going to request, if my colleagues are comfortable with this, is that I think this should be heard at the Board of Supervisors with just with an update, and I'd like it to be done in time for the board to have options reflecting the past direction of the board would be helpful. And Supervisor Ellenberg, just to let you know, the board has had a lot of different discussions about this, and one of the areas that I had asked to have investigation was just whether or not the market changes might require us to have a public option, meaning that we have to do this ourselves. I don't know the answer to that, but I want to make sure that the information comes back to the board. And we requested, by the way, a timeline and a work plan that would help us understand the process by which an RFP or an RFQ might be pursued. So that's why I'm asking it to come back to the board instead of for an off-agenda report. And if it could come back to FGOC prior to the board would be helpful.
I can give you a little bit of an answer to part of the question, but we'll definitely come back to FGOC. What we're discussing at this point is that the EMS department at the state level has changed their policy, partly due to litigation from the firefighters. But as the board will remember, they threatened to remove our antitrust exemption based on a policy that they had never actually gone through the process with. And so at this point, that's reversed. They're not going to remove our exclusive operating procedure. That gives us quite a bit of leeway with the possibility of creating a model like you're discussing, a public model for this service. And it also gives the board quite a bit of leeway with regards to the current contract, which could be extended. So we've been working with the provider and plan to come back to the board with recommendations related to that, because we did hear the request that you and the rest of the board made, President Chavez, to give you the most options possible. So we are working on that, and looks like it'll be a good outcome.
Thank you, Dr. Smith. That's very interesting update. That does change the game quite a bit. We're going to go to public comment and then back to the board for action.
My apologies. Our first speaker is Tina Garcia. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Can you hear me?
Yes, we can.
Okay. It's Tiny Garcia, sorry. I'm specifically speaking on COVID danger for incarcerated people in custody. And we have a family member in custody, Joey Villarreal, who is a leader, a healer in his community, an author, a poet, and is at risk, like many folks right now incarcerated, of getting a fatal illness because of this incarceration nation that makes money on poor people's custody. So we are asking that all people be released who have this situation in this moment of crisis. And we're asking that Joey Villarreal be released because we need him in the community like so many of our fathers and sons and brothers and uncles, so that we can continue to raise the next generation.
Thank you. We're going to go back to the board for action on 85 and 86. See no other comments. Can I get a motion?
Yes, motion to approve.
We have a motion to approve from Supervisor Wasserman with the request to have it come back to the board instead of an off-agenda report through FGOC. A second from?
A second.
From Supervisor Ellenberg. Seeing no more discussion, I'd like to request a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
Yes.
Thank you.
The last item in this section is I think it is the Valley Health Plan. And I will just say that, or ask, is there any presentation from staff on this item?
That's nothing besides what's in your packet.
Thank you. Is there any public comment on this item? This is item 87. This is the Valley Health Plan budget. Seeing no public commenters, I'm now going to go to the board. Supervisors Cortese, do you have any comments on this item?
No, thank you.
Supervisor Ellenberg?
No comments.
Supervisor Simidian?
No comments at this time, Madam Chair. Thank you.
Supervisor Wasserman?
No, I can make the motion for approval.
please do.
Motion to approve 87 and move forward.
And we have a second?
Second.
Thank you. The only thing I wanted to ask staff is, as part of Valley Health Plan, are we considering the expansion of making the health plan available to folks who potentially lost their insurance through COVID-19?
Yes, we are. We're trying to expand the availability of the health plan in a number of ways. And part of it is dependent upon what happens with California budget and what new projects they come up with. But the simple answer to your question is yes, and we have to find a mechanism to do it.
Thank you. And one of the reasons that I am raising this is there was a recommendation from Harvey Rose about taking $15 million from the plan. And part of the reason I'm not interested in doing that is that the cost of the plan for the average person is relatively high, as all healthcare is. So I'm not judging us, but what I would be interested in understanding is whether or not Valley Health Plan alone or in partnership with the Family Health Plan could look to put a fund together that would allow us to buy down the cost of health insurance for families over a specified period of time while we're going through COVID-19.
We'll definitely look into it.
Thank you. All right, seeing no other comments from my colleagues, I'll request a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
Yes.
Thank you.
Thank you all very much. I'm going to request a 10-minute break before we go into the next section. And just for the public, the next section is items 89 through 108, and this is all of our public safety and justice organizations. We'll be back.
88.
I'm going to ask what's that?
You said 89. I think we still have 88.
I'm sorry, 88. Thank you. I misspoke. 88 through 108, and we'll come back at about 5 to 5. I'm sorry, at 5 to 5. I am so blind. We'll come back at 4:30. Thanks.
4:30?
Yeah, 4:30. I'm going to give you 15 minutes. There you go. Go wild with that extra 5. 4:30. Thanks.
Call Jay Boyarski Mobile. I can't think the internet has died for the last 15.
Welcome back, everyone. I'm going to ask for my colleagues to come back, and as they do, once they are available, we're going to do a roll call vote to reestablish the quorum. If I could turn to our clerk to do just that.
Supervisor Ellenberg.
Sorry, here.
Thank you. Supervisor Smidian.
Here.
Supervisor Cortese.
I'm here.
Vice President Wasserman.
And I am too.
President Chavez.
Here.
Thank you. You have a quorum.
Thank you very much. I just want to go over how we're going to handle this section as well. I'll go to see if any of my colleagues want to act on anything early, but we're going to take each section by section, and we'll ask for a brief presentation. And if you've given us something in writing, it's not necessary to go long, but if we just got it like today or yesterday, it might not be bad to dive in. Then we'll take the items under each section. We'll go to public comment. We'll have a presentation, public comment, then board comments and action. And we'll do that for all the rest of them, unless there's something that someone would like to act on right away. Supervisor Wasserman.
Thank you. And I saw that little raise hand button down at the bottom of the screen. I'm finally catching on here.
I know, I'm so impressed. Well done.
Thank you. Thank you. I'll make a motion that we move 108 medical examiner forward at this time.
I have some questions on it, and so I'm gonna ask that it stay on the regular agenda. And I'm sorry to the corner because I know they're last, but there you go. Thank you. I'm going to go to the office of the district attorney, and I will start with Greg to see if Greg has any comments and or if the district attorney has any comments. This is items 88 and 89. I will alert the public that if you want to speak on 88 and 89, this would be the time to raise your hands. Thank you.
I will start, President Chavez. I was encouraged to hear the discussion we just had about behavioral health, because now we come to a point where we're dealing with the criminal justice system. So as we get started, I wanted to give the board some basic information that I think reflects some of the discussion the board has had about Black Lives Matter, the equity, racial equity issues, and a number of issues related to diversion. So really, this is quite short. It's really just some basic information to help elucidate the board about how we in administration made our suggestions. We, as I mentioned before, asked a certain number of departments focusing on the criminal justice departments to come up with targets. The proposals did not meet the targets, so we took the position that in departments where there had been relatively rapid growth of the department and the budget and decreases in the services, that the elimination of unfilled funded positions was a reasonable approach for the board to take. So right before you, I think you can see a the history of case filings and convictions over the last 5 years. You can see that misdemeanors are going down pretty significantly. That's the top line. Those are the misdemeanors where there's a conviction. Misdemeanors that are not convictions are pretty small. Felonies are also going down, but not as significantly. But we would expect with the bend the arc reforms that the DA is advancing, that the misdemeanor filings and convictions would go down significantly, and also Since he's proposing not doing capital cases, the felonies would go down somewhat. This is jail bookings to switch from the courts and the DA's office to the jail. You can see that the incarcerations for misdemeanors is going down significantly, and the incarcerations for felonies is going down. I'm sorry, bookings, that is. Here's a transition to our jail census. You can see back in 2015, we had a census of 3,695. We're now down to 2,100. Pretty dramatic reduction in the last few years with all of the diversion efforts that the board is doing, plus with COVID and further diversions that occurred. This is actually pretrial response to the diversion process that the board has supported. These are pretrial releases. These are individuals who are being monitored by pretrial. You can see we started off in 2015 with a relatively small number. We've more than doubled that now to 3,100. So essentially what this represents is those individuals being followed in the community by pretrial rather than being incarcerated, and I think we've made a lot of progress. This combines the last two charts showing at the bottom what the number of pretrial is and the total, and you can see that the number of pretrial over here at the very right is increasing, so that we're having a much larger population of what would be inmates now in the community being supervised and getting our services. Then switching to juvenile justice, because we're going to talk about probation a little later on, you can see that this is 2015 to 2019. On the left is arrests and citations also going down. Referrals to juvenile hall going down. That's just referrals, that's not census. Our census has gone down dramatically in the last 10 years. Admissions to juvenile hall also going down. Petitions filed going way down. So I wanted to give you that context about how we thought about making our recommendations and our suggestions. And with that, I will turn it over to the president.
Thank you very much. DA Rosen, did you want to make some opening comments?
Yes, please. Can you hear me, Supervisor?
Yes.
Chavez?
Yes.
Thank you very much. Thank you for inviting me to make some introductory comments. For the last 10 years, this district attorney's office has been an excellent of Santa Clara County. The district attorney's office is a creative, thoughtful, and proactive organization within the county. The county has looked to the DA's office to help with difficult problems, and the DA's office has always made things better, brought stakeholders together, and completed the mission. For example, enforcing the public health order with a team of prosecutors and investigators working collaboratively with 27 different organizations, responding to almost 12,000 referrals, and initiating more than 2,000 unique investigations. Secondly, bringing victim services into the DA's office, serving thousands and thousands of crime victims, standing up a family assistance center within 24 hours of the Gilroy Garlic Festival mass shooting, creating a Gilroy Strong Resiliency Center, and becoming a national model for the delivery of services after a mass shooting. We're coordinating the creation of a child advocacy center to better serve children who have been physically and sexually abused. We've created, with the county's help, a team of community prosecutors who serve all over the county to reduce youth crime, graffiti, and blight while strengthening impoverished and crime-impacted neighborhoods, and accelerating the testing of rape kits at the crime laboratory. We thank Supervisor Chavez and all the supervisors for the we demonstrated national leadership in the areas of
Jeff, you're breaking up quite a lot, DA Rosen. And so I don't know what, it might help if you turn your screen off. It might make, sometimes that works. I don't actually know why.
My internet connection is very weak. We've had some power outages in our servers in the DA's office today, and I'm told that that's affecting our Wi-Fi connection. Can you hear me now?
Yeah, we can. Go ahead.
Okay. Maybe if I get closer to the computer screen, that helps. I don't know. We've demonstrated national leadership in the areas of human trafficking investigations and cyber currency fraud, which has led to arrests all over the country and prosecution and convictions here in Santa Clara County. These difficult issues and many more have been taken on by the DA's office in strong partnership with many county and community-based stakeholders. Our mission can be summarized in 3 words: make it better. Make it better. The importance of public safety. Quote, public safety services are critically important to the security and well-being of the state's citizens and to the growth and revitalization of the state's economic base, unquote. Second quote, the protection of the public safety is the first responsibility of local government, and local officials have an obligation to give priority to the provision of adequate public safety services. That's directly from the California Constitution, Article 13, Section 35. Now, while it's true that crime fell during the first month of shelter in place, since then, crime has begun to return to levels consistent with 2019. In fact, in the city of San Jose, murders are up significantly. The DA's office is a strong force for public safety, which is a precondition for all other endeavors in a community. Public safety, as recognized in the California Constitution, is the precondition for all other endeavors in a community. Now, here is the ask. I am asking this Board of Supervisors, this board, Supervisor Wasserman, Supervisor Simidian, Supervisor Cortese, Supervisor Chavez, and Supervisor Ellenberg. I am asking this Board of Supervisors, who I have worked productively and collaboratively with for many years, to adopt the recommendations in my August 18th, 2020 memo. Specifically, please direct the County Executive's Office to find $844,000 in savings from somewhere else within the county's more than $1 billion discretionary budget. Perhaps the money can be found from other county departments that have not acted as cooperatively or constructively as the DA's office. Number 2, allow the DA's office to manage its vacant positions to achieve the budget savings that the county needs. A top-down, rigid, one-size-fits-all approach is not a good one for the DA's office, which is run by the elected DA, who is directly accountable to the people of Santa Clara County. While it may make more sense for the county executive's budget director to manage the resources of other county departments, that is not the case when it comes to the DA's office. The approach I have put forward will save the same dollars, but give the DA's office the ability to continue to be innovative, creative, and flexible with our staff to achieve our mission. Please give the DA's office the flexibility to manage the resources of the DA's office. This can be done with innovation and transparency to save the money that needs to be saved and to provide the services that need to be provided to ensure public safety, justice, and equity for everyone in our community. Those are my introductory comments. I'm happy to take some questions, if there are any.
Thank you very much. I'm going to now go to the public, and I'm going to, Jeff, I'm going to mute you, but only because of the feedback. Thanks. All right. I never want to mute the DA or sheriff or anybody else. All right, we're going to go to public comment, and I'm going to ask if our clerk could begin calling public comment.
Our first speaker is Tina Brown. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Go ahead, Tina.
As stated on my earlier call, I am a system impacted family member. The practices of the Santa Clara County criminal justice system needs to be changed today. It is an extremely punitive and violent system that impacts many. It must end its tactics of the school to prison pipeline, gang enhancements, forced plea deals, and excessive sentences that result in mass incarceration. This is not public safety. This is continued trauma. All people in our community deserve a fair and just system that should include safety, restorative justice, healing, and hope without racial disparity and continued harm. The Protect Your People County budget proposal that has been presented includes these important things. Thank you for your time.
Our next speaker is Cecilia Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Cecilia, go ahead and unmute yourself. Cecilia Chavez, and we will come back. Our next speaker is Debug Community Meeting. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Jose Valle with Silicon Valley Debug. I want to take this time to speak in support of the Protect Your People budget proposal authored by families directly impacted by police violence and the criminal justice system. I'm also in support of the Santa Clara County Jail's hunger strike and worker strike in the main jail in Elmwood will not stop until the jail administration and elected officials adhere to their demands. Gang enhancements are often longer sentences than the actual underlying charge itself, and can easily be a lot of the times it's longer than the actual sentence, the underlying charge, and could easily make a sentence a life sentence. I think it's racist, and I also believe that the DA's Bend the Arc initiative is not good enough. I think it's a slap in the face, some of the comments that he made. Appreciate it. Thank you.
Our next speaker is Halisa Gutierrez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Jalissa Gutierrez. I am a youth organizer at Silicon Valley Debug. My dad has also been impacted by racist gang enhancements, currently serving time in prison. As a young Chicana, I am calling in support of this Protect Your People budget proposal and the current hunger strike to end gang enhancements, racist gang enhancements, 3 strike laws, and outwalk. This is important to me because I drive 5 hours and a half every weekend to see my dad in prison. It was a gang enhancement that gave my dad a life sentence. He should be home with me and my siblings, and gang enhancements and invest in our communities of color. Thank you.
Our next speaker is Salvador. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Yes, good afternoon, board. I'd like to comment on Mr. Rosen's speech and presentation. I don't think he meant it, but I found it very offensive and disrespectful that he's asking the Board of Supervisors to find and cut basically staff and positions from other departments that are already facing serious cuts themselves to save his own district attorney's office. There's a lot of people that are going to be losing jobs. Our services are going to be depleted, but for him to take the selfish stand and worry about his own, say, hey, help me keep mine, but forget about everyone else. I think that's very disrespectful and very concerning, considering that he's an elected official, and he needs to remember that come election time. Thank you.
Our next speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Good afternoon, everyone. Looks like in our district attorney's office, we need to save a little money. I've been through this process myself, being a business owner in the past and having gone through some recessions. Maybe, just maybe, Jeff, that we could stop prosecuting people for exercising their democratic values. One clean and sober father utilizing sound amplified devices on a sidewalk. No Maltal cocktails, no beating anybody up, no knives, no guns, no criminal record, all those other good things. You would save right now probably about half of that chunk of dough you're needing right now for your staff and you're needing for the district attorney's office to run properly. So you're all aware, Victim Services Unit out the gates should have provided me with some type of counseling. I started coming to your meetings about 4 years ago. I needed therapy. I needed services, and I would have been entitled to that. Instead, I got prosecuted by Jeff Rosen rather than getting the help that I needed. I think we need to look into that, and I think we need to pick people back up rather than push them back down. Thank you.
Our next speaker is Molly McLeod. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Molly McLeod, and I am speaking in favor of the Protect Your People budget. I'm also speaking as a white mother of a Black son who was beaten by the San Jose Police Department, is part of the statistics of DA Rosen's, and who I've spoke up about before the Blue Ribbon Commission when he had been incarcerated for a library book, walking out with a book of homonyms. And that was the first criminalizing that he experienced at the MLK library. My heart is broken because my son was the victim of a felony hit and run. And let me tell you that I don't want the driver to be in jail because that could be a death sentence. Please don't spend the money on the DA. Put it in community where it belongs.
Our next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
DA Rosen said that the office goes by 3 words: make it better. I would argue that the way to do so is actually 3 other words: make it smaller. To decrease the DA's budget means saving money and saving lives. The violence of incarceration is uniquely a multiplier cost that this county bears in ways that may not even be identifiable in one budget hearing with one department. At the same time, it's destroying families and communities across the county. And actually, to reduce the DA's office budget fulfills the vision behind bending the arc. It is by challenging this assumption that incarceration equates to public safety. Incarceration does not mean public safety. It doesn't mean keeping people in jail cells during a lethal pandemic or charging kids as adults. Sometimes less is more, and this is certainly true when it comes to prosecution. Thank you.
Our next speaker is Desiree Victor. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm Desiree Victor, the site director of the Young Women's Freedom Center in Santa Clara County, working with and on behalf of communities specifically impacted by the criminal justice system. Right now, the purview of decision makers has focused on what to say with the presented cuts, understandable, but I want to center your authority and accountability to the priority of public safety and what that really means. We're at a point in history where the dangers of criminalizing systems like the DA's and Sheriff's Department's cause is being addressed, and you all cannot turn your heads from that data. Not only do you need to cut these harmful systems you invested in, like punitive policies constructed by the DA in regards to gang enhancements, specifically when it comes to children and contributing to the school to prison pipeline. You also have to invest in undoing and rebuilding that harm, investing in communities and investment in public safety, following community models of safety like the ones developed by the families working with and through DBUG and the Protect Your People budget is an investment in community safety.
Our next speaker is Rosie Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, my name is Rosie Chavez. I'm also a family that works side by side with Silicon Valley DBUG and helped put together this Protect Your People proposal, budget proposal, and I'm supporting that. And I've also been a family who's been impacted through losing a loved one through the police violence and he's been through the criminal system. You talked about victims' youth. My nephew left 3 babies behind, and they're not offered not once, any type of trauma-informed therapy. Instead, they were turned away and said they weren't the victims. I would like to see some community investment into the youth that are left behind fatherless because of the acts of police violence. Thank you.
Our next speaker is Noah Alvarez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. I'm sorry, Noah, go ahead.
Hi, my name is Melissa, and my husband is at the San Jose main jail. He is part of a justice system that oppresses, and that is also a form of family separation. My husband seeks guidance and wants to do better and has a support system when he hopefully comes out one day to be part of our community. Throwing the book at people whenever possible, which Santa Clara County is known for, is not the solution. Length of time has no relationship with recidivism. Fiscally doesn't make sense either, but we have a solution, and it's in our Protect Your People budget. So please read it, and please, thank you.
Our next speaker is Cecilia Chavez. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, and I want to speak as well to DA Rosen's comments. As you could clearly hear, public safety is being defined by the people here, and it doesn't mean more incarceration. It means less incarceration, just as Raj mentioned earlier. I know you're aware of the work that Silicon Valley DBUG does and the work that we do with many of the families who are prosecuted by your office. You know, we want you to take a closer look at the letter that you sent to the board, asking them not to cut from your budget, and you comparing that to any cuts, like, for example, for the public defenders budget, saying it should be matched. The public defender should get more funds because they're protecting our community, where on the other side, you're the one that is criminalizing our community and locking them up.
Our next speaker is Anna Z. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, my name is Anna Zeiger. I'm a resident of Santa Clara County and a member of Showing Up for Racial Justice at Sacred Heart. I support Silicon Valley DBUG's calls to read and enact the Protect Your People budget, including the call to reduce the district attorney's budget. Thank you.
Thank you. That concludes our speakers. Madam President, you're muted.
Thank you. Been saying that to people all day. Thank you very much, and I want to thank all of our speakers. I'm now going to turn to the Board of Supervisors, And I will begin with Supervisor Ellenberg. Supervisor Cortese has stepped away as there is a fire in Mount Hamilton that he is addressing. Supervisor Ellenberg, you're on mute.
Okay, got it. Thank you. I'd like to ask a question of Greg Gutierrez, if he's still with us.
Yes, I'm here.
Thanks, Greg. In the supplement that was provided by District Attorney Rosen, he highlights positions which are entirely funded by outside grants. Can you clarify what is the department's reasoning for cutting positions that are funded by outside grants and don't have an impact on the general fund, please?
There was a program manager 2 vacancy in the victim witness program that the department was planning to cover with victim witness grants. We see that there are other victim witness costs that aren't currently covered by grants, have a general fund expense. And the thought was to use those grants to cover currently filled positions instead of having the general fund bear that cost, and still, of course, actively pursue those grants and earnestly deliver on the requirements. That's the thinking behind the recommendations.
So let me just make sure I understand it. So your hope was that those grants would still be applied for, but would be used to cover other positions than the ones that they're currently matched with?
Yeah, to use existing filled positions to perform the work and get reimbursement. Thank you.
So the goal is still overall. What I'm trying to just be clear on is whether there was any reasoning or thinking beyond getting the overall amount of general fund dollars down, because that's a very specific direction, spending it on one position and not another.
Yeah, the main focus, because we didn't have all the requested information that we had sought, like we had received from other departments. Our focus was not only to reduce general fund costs towards our structural budget deficit, but also to have a focus on where there are currently funded vacant positions and try to do it in a way that would minimize service impacts, realizing that we would be trying to preserve our current workforce, not necessarily filling vacancies to expand the current workforce.
And you said that you hadn't gotten information. I assume that your office and the district attorney has already had multiple conversations on this subject. Is that correct?
Yes, that's correct. We didn't receive all the information that we had requested, so we worked with the information that we had.
So you're saying yes. I'm looking at District Attorney Rosen shaking his head no.
No, it's not true. And this is an example of having the budget director manage the DA's budget instead of the DA on something that doesn't cost the county any money. So I don't understand. I really don't understand cutting positions that are funded by the state. Doesn't cost the county any money, doesn't save the county any money to cut the position, and it doesn't cost the county any money to have the position. And the discussion about maybe that grant money should be spent someplace else, the DA is managing the DA resources, and we're doing it in a way, in this case, that doesn't cost the county any money. And I think this is an example of how the DA's office knows its budget better and can manage its resources more effectively than the budget director from the CEO's office, who's got 50 different budgets to look at.
I appreciate that. Greg, is there anything else that you want to add? There's a clear, if not miscommunication, significant disagreement on what the communication was.
Yes, I think there's a disagreement on the degree of satisfactory providing enough information so we can make informed decisions on what kind of a reduction package to take to the board for consideration.
Okay, Thank you. I'm interested at this point to hear from my other colleagues. Thank you.
Supervisor Simitian, do you have any comments or questions on this budget?
Yes, if Dr. Smith is available, I'd like to engage with our CEO for a moment.
Yes, I'm available.
Thank you. Dr. Smith, these are comments obviously not just for you, but for my colleagues and the staff and the public. I think I do think it's a struggle when we're dealing with the offices of independently elected officials, because I think there is some merit to the observation that the independently elected official who manages the organization is closest to the day-to-day work of the organization and understands its workings, so on and so forth. That being said, we've had occasion over the last few years to visit and revisit Section 25303 of the California Government Code that talks about the fact that, not only is it the board's obligation to manage the budget of the county, but that, nothing in that language is construed to limit our authority over the budgets of both the sheriff and the district attorney. So there's a built-in tension. I don't think that that's a bad thing. I just think it's the way the system is set up. I guess my ask of you is whether a little more conversation between now and Friday is possible. I know that this is a significant item, and I know you've already had some conversation, but and if it's just a question of, nope, we got to, make the choice, I'm prepared to hear that. But I think what I'd like to say to all parties, if you can come back to something that's a little more fully reconciled in the two views, respecting the district attorney's insights into his own operation, but respecting as well the board's obligation and responsibility and authority to make the budget decision with staff guidance, that'd be a better outcome. If you can't get to yes, then I would probably be prepared to move the staff recommendation. But I'd like to see if we couldn't get a little closer to an understanding. Is that is that a doable thing? Let's try it that way. See if I can get a yes.
Well, I guess I would say that if we can get a commitment today from the DA that we'll come up with actual, real, tangible savings in terms of eliminating positions of $4 million, we have a chance of coming up with something by Friday. But if that's not going to be the commitment, then I don't think it'll be worth having that episode of discussion. I mean, it basically boils down to, these are vacant positions. Whatever's being done in the DA's office now is being done without an incumbent in those positions. If the DA would like to pick other positions, fine, but that will mean laying off people who are already in those positions. If the DA would rather suggest layoffs, then the board can discuss that.
I think Madam Chair, after hearing from my colleagues, I'm prepared to make a motion. Respectfully, I don't think it's appropriate to ask the district attorney for a commitment. We've all worked together over the years. This is hard stuff. I fully anticipate that he'll make a good faith effort. And if you have to come back with a difference of opinion, so be it. That's why boards sit down and make these decisions. But right now, conversation's a little scratchy. Okay, that's also going to be the case during difficult budget discussions. But if we can get to a better place with a few extra days, I'd like to see us try. So my motion in a moment or two will be to continue the item till Friday and ask both parties to go off and make a good faith effort to harmonize to the extent that they think they sensibly can do so. And again, the incentive I want to give the district attorney and his office is otherwise, my current inclination would be to get would be to support the administration's proposal, and I hope that gives all parties some incentive to find that $800,000 in the gap. So call me an optimist, but I think it's doable.
So we have a motion. Do we have a second for that motion?
I'll second for purposes of discussion.
So you are seconding a motion focused on harmonization. That's the first time I've ever heard Supervisor Simitian use that in a motion. So I'm going to just lift that up for a moment. So we have a motion from Supervisor Simitian, a second from Supervisor Wasserman to elicit more discussion. I'll now go to Supervisor Wasserman.
Thank you. I want to bring up a little different angle. Again, like I've said a couple times before, this is a third of our budget. This is just part one of a three-phase thing that we got to go through, and it's already difficult. What I wanted to bring up, and again, I supported the motion to bring back some more compromised discussion between now and Friday in the hopes of getting more towards that dollar amount. What I want to bring up is the idea regarding the currently funded vacant positions that are being recommended to be removed. And what I know I've experienced, I was going to say I won't speak for the other supervisors, but I believe I can come pretty darn close. We've had issues, especially in areas that dealt with attorneys, be it county counsel, public defender, district attorney, in hiring people, filling them in a timely manner. We're working on our whole hiring ESA process that's ongoing. I know Supervisor Chavez that you and I are on a similar page as far as that goes. And what I was thinking about was if we delete these positions, then at some point, God willing, our economy and the world comes back to some sort of normalcy, we'll be wanting to fill up positions, and then we have to create positions and go through all of that. I was looking at the idea, and I would ask through the chair to Mr. Rosen and to administration that it be included in what you come back with, the idea of defunding them, but not deleting them. And that way the codes, the positions would still exist, but they would not have any money associated with them. What we've been deleting is funded vacant positions. I'm concerned about 6 months from now, 12 months from now, when things are looking better, we've had some attrition, some people leave, etc. But I would put some caveats on those, Mr. Rosen. I would put that if we go down that road, that you cannot arbitrarily fill them. You'd have to have the dollars available, and I see you nodding your head. You'd have to have the dollars available in which to fill them and get approval to do so effectively. Okay, it's very similar to our comprehensive attrition plan we're going through right now, where if we lose a person, in order to refill it, they need administration's approval. What I'm trying to do, and this kind of ties in, and Supervisor Simitian is gone now. We have 2 fires burning that are heading towards 60,000 acres. One coming down into his district, the other one south of us. But what I'm looking at is, okay, we eliminate the funding, which reduces the budget, which is what we've got to do, but we keep the positions still there so that when we need to fill them, when we're able to fill them, when we agree to fill them, that then they're there to be filled, as compared to starting the whole process over of creating codes and positions.
So Mike, you may recall that we raised this on Monday as a part, I think we'll go to Dr. Smith, but one request that I would just have is that I think this has been raised in different forms and using different language, but I think ultimately what we're trying to figure out is how do you create accountability and flexibility? So you're accountable for the money, but each department has the flexibility to be responsive in a way that is appropriate, based on a number of other issues. I think that's a big, I think it is a big discussion. I'm hopeful that will also be talked about, because I think in Supervisor Simitian's motion, that is an area of disagreement between these two bodies. But it's also, I think, an issue that I'm really interested in figuring out how to wrestle to the ground. So appreciate your follow-up on that. Mike, did you have anything else?
No, ma'am.
Okay, so we had a motion and a second. Any other discussion? Oh, I'm sorry, Dr. Smith. I'm sorry. I observed your hand. I apologize for that.
Yeah, I just wanted to point out that if you don't eliminate the positions, you don't make the savings. That's just the facts of the matter. If we take that stance with all departments, even if we take that stance with all elected department heads, then you're going to be cutting actually to the bone of everything else.
And I see a lot of people jumping in who have not figured out how to use their blue hands, but they're using their regular hands. So I don't know who came first, but I'm going to go to Supervisors Committee and then Supervisor Wasserman.
Thank you. Madam Chair, I just want to clarify, I am not suggesting that the positions don't have to be eliminated. Quite the opposite. I'm going to take this opportunity, since it's been given, to say I think in general, our staff have done a very good job of laying out a path for our board and our county to get to the best place we can in a very difficult circumstance. It addresses the need to make these savings. It has focused on positions which are vacant almost entirely, so that we're not talking about furloughs and we're not talking about a loss of services. In some cases, there are positions that are currently occupied, but I believe in virtually all of those, there's an opportunity for those folks to slide over into another code. And I think I don't want there to be any misimpression. I absolutely agree. We need to make the savings. And I'm communicating that to Mr. Rosen and to Dr. Smith both. I think Mr. Rosen fully understood that. While he's asking for a somewhat reduced hit, fair enough, folks are going to make those requests. What I mostly heard him say was, could the county executive and his budget team be a little bit more mindful of the district attorney's notions about how those savings could be made. So I'm hoping that's what happens over the next few days, that if there are some misunderstandings, they get clarified. But Dr. Smith, I want to say to you and your team, and again, I think you've laid out a pretty good path for us. I absolutely not only understand, but support the need to make these savings now, because the longer we wait, the more difficult it will be. Thank you, Madam Chair.
Thank you. I'm going to go to Supervisor Wasserman and then go ahead, Mike.
Thank you. I'm hearing, and I'll just admit, not understanding the, I guess, internal accounting that goes with having a vacant, unfunded position not be, if I understood Dr. Smith correctly, not actually produce savings to the general fund. And if that could please be explained to me, I guess I'm sharing now. Dr. Smith, if you could please explain to me, and I may be the only one here that doesn't understand that, why if we don't fund a position, why that's still basically considered an expense.
Essentially, it boils down to the fact that hiring is done through the PeopleSoft system with NeoGov. And PeopleSoft and NeoGov don't recognize whether or not a position is funded. SAP recognizes whether a position is funded. So basically, a appointing authority can utilize a position that's in PeopleSoft and hire them into it. And then, we end up having a perpetual cost. The only way that we could do what you're talking about would be an extensive, extreme position control, where basically we prevent the DA's staff from seeing PeopleSoft. I don't think he would be too happy with that.
Mr. Rosen?
Yes, if the position is vacant, we're not funding it. There's money's not being spent. And if the concern is, well, the DA's office is gonna cheat and is gonna, hire the person anyway, like we've laid out in our memo that we have to go to the freeze committee now because there's a hiring freeze in the county generally, and to hire any position, we have to get an exemption from the freeze committee. So really what I'm saying, in addition to the delta of about $800,000 between the CEO's recommendation, my recommendation, the other really significant point that I emphasize is extremely important to the DA is that if you hold the positions vacant, you get the money savings, and we would only be able to fill those positions if the freeze committee, which is put together by the county CEO, gave us permission to. So it's a check on our ability to fill those positions and make sure the county gets the savings it desires. Frankly,
You muted, Jeff, you're muted.
Jeff, you went out.
No, what I was going to say is if the county said we need X million dollars from the DA's office, my preference would be, fine, I'll find the savings for it and produce that. And you can hold me accountable for that. That's because I'm elected to run this office. So I definitely want to have some further discussions with Dr. Smith. I think we may be able to narrow the delta between our two positions, but I also think that conceptually we can get to a point where we keep the positions, we don't delete them, but we keep them vacant and unfunded. And there's a check on our ability in the DA's office to hire because it has to go through the freeze committee. The reason that's desirable to the DA's office is, as you pointed out, Supervisor Wasserman, the process of creating new positions and going through ESA to work with them is maddening and will take us a tremendously long period of time. So this is a way for the DA's office to be flexible within these budget constraints. And that's really what I'm asking for, is some flexibility to be able to manage the resources, produce the savings that the county needs produced, and also direct the resources where they need to be directed.
Respectfully, we did ask for a proposal for reductions, and we did not get a proposal that met the targets. I understand the DA felt that target was too big. I'm very happy to sit down with Jeff and figure out some way of coming up with a conclusion, but I don't want it to be portrayed that administration hasn't been trying to work on this for months.
Thank you. I think we have a motion and I believe a second. And I want to see if there are any other comments on the motion. All right. So with that, I'm going to request a roll call vote.
Can we just repeat the motion, Supervisor Chavez? I'm back here, but I didn't.
Thank you. The motion from Supervisor Simidian was to ask the district attorney and the CEO to take the next 24 hours. We didn't want to give them too much time, 48 hours, to have a conversation to see if there could be a meeting of the minds as to a presentation to the board for Friday's action.
All right, thank you.
Motion by Simidian, second by Wasserman. Seeing no other discussion on the motion, I'm going to ask for a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Yes.
President Chavez?
Yes.
Thank you.
Thanks all. We're now going to move to the public defender. This is items 90 and 91. So if you are listening and would like to speak to items 90 or 91, this would be the time to call in. What I would like to do is see if there are any comments, overarching comments from Mr. Ateria.
Yes, we have nothing to add beyond what's already in your agenda packet.
Thank you. Are there any comments from the public defender?
Good afternoon, Supervisor Chavez. I am available should there be any questions. Thank you.
Thank you. We'll then go to public comment. We have one speaker on this item.
Our first speaker is Scott Largent. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. Our first line of defense in the indigent community is the Public Defender's Office. I've spent plenty of time doing the research on the Santa Clara County Public Defender's Office and ones throughout the United States. I think we need an elected public defender here. I think that would I think that would give her more power, him or her, to basically stand up for the community. I am very concerned that my community complaints have never been addressed, and that people on a civil level and a family level are getting abused in our judicial system. A lot of our courts are a scam. I keep bringing this up. I am being prosecuted on a civil level now. The city attorney's coming after me, the district attorney's coming after me, and this is all for the same activity, for the same case that I went to the public defender's office at. And they just sit back and they just watch through that window and they don't do anything. So thank you.
Thank you. We have no other speakers on this item. I am going to go back to the board. I'll start with Supervisor Cortese, see if there are any comments.
No, I'm very clear. Thank you.
Thank you. Supervisor Ellenberg?
No comments.
Thank you. Supervisor Wasserman? Sorry. Thank you. Supervisor Smidian?
No comments or questions at this time. Thank you.
Thank you. Can I go to the board for a motion? On the one hand, are you waiting for one hand on the other hand?
Just one hand. I'm raising my hand to make a motion to approve.
We have a motion.
Second.
And we have a motion and we have a second. I just had one question on this item. If I could ask and Greg, this may actually be a question for you. I cannot recall, and I don't have the paper that you gave us about the reductions in June, but did the Public Defender's Office have reductions in June?
In the June budget, it had a placeholder amount of $1 million to provide the public defender time to make those informed decisions of what are the right positions to swap out for that. And that's what this revised recommendation carries out on number 90.
Oh, I see. So this was an action from June that's just being, that for lack of a better word, is being codified.
Yep. That's right. To get the specifics so we can have that ongoing solution to our structural deficit.
Thank you. This is one that that I'm concerned about, frankly, supporting. And my main concern is that I think this is one of our more underfunded offices. And what is hard to understand actually from looking at this is there's not a lot of information in the report, so it's hard to know what the
Copy that's the number 4. If you could also
hold on one second. Okay, thank you, whoever got that. It's hard to understand what the impacts will be in terms of workload, because there's no here's what our workload is now and here's what it will be. So I raise this as a concern. I'm gonna go forward with it in part because I don't understand. I mean, it doesn't, anyway, it's not codifying what the impacts are. The one thing I'd like to recommend in the future though for this particular office is better understanding those impacts. Now, to my colleagues, I'll just remind my colleagues that there is a Harvey Rose audit that's going to look at the needs of the Public Defender's Office. So I also don't want an interpretation to be that by taking this action, that we cut off our ability to really look at what the needs of the office are that we are looking at through the Harvey Rose audit. So that is my comment. And Public Defender, would you like to make a comment? You put your screen on, so.
I just wanted you to know I was still here. And in terms of the underfunding, the way that we reached the particular cuts was to talk to supervisors of units within our office to try to figure out where, if we were having to make a cut, we could do it with the least impact to service. But to your point about our funding, I would just like the board to understand that we have been doing, to Mr. Zayadev's point, the undoing of criminal justice harms for the last 5 or 6 years, pretty much with an unfunded mandate to look back at youthful offender parole, felony murder resentencings, sorts of rehab, 3 strikes reform. So we have a lot of work to do in that area. It's very time and labor intensive. We've made that point to the Harvey Rose auditors, but while we were able to manage these cuts, we don't have enough social workers, and we have a lot of post-conviction work that takes a lot of man hours and woman hours, hasn't traditionally been within our realm of responsibility. So I just wanted to throw that out for the board. And
oh, sorry, Molly, I didn't mean to cut you off.
No, I'm done.
Okay, thanks, Molly. I mean, Public Defender O'Neill. So do we have a motion on this item?
Yes.
We did already from Supervisor Wasserman. Do we have we had a second already from Susan?
Yes.
Okay, so we have a motion and we have a second. I'm going to request a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Semidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
Yes.
Thank you.
Thank you very much. We're going to move on. Our next item is is pretrial services. So this is 92 and 93. I don't know if there's any overarching comments from the staff.
There's nothing to add besides what's in your packet.
Thank you. And I know I saw Mr. Fisk is here. Is there any overarching comments you'd like to make?
No, I'd just like to add that we're grateful for every penny that we receive. Our budget's about $10 million. We have discretion over 1% of that, about $100,000.
Wow.
We're definitely not doing this alone. It's the efforts of the public defender, the district attorney, and the sheriff that help us to do this. It's a little bit awkward. We're actually receiving 4 additional positions with this budget amidst cuts. I just want to recognize that. Those positions are, we run very leanly. Those positions are devoted to the increased client load. A lot of people were released from jail. We took on some of those people, a good portion of them actually. And so the jail population is down by about 1,100 or 1,200 people. We've taken on in that period of time about 900 to 1,000 people.
Thank you, Matt.
Yes. Leave it at that.
Thanks. And I didn't mean to cut you off. I thought you're so quiet. Were you done?
I think that's it. I feel like I need to make one comment, and that is that in the abstract, I hear a lot of comments about just defund this and just cut that. It feels good to say that, and it would be nice if it were that simple. These are challenges, and having served as a counselor and a probation officer and a court administrator, all of the parts of our system are very valuable. The only thing I would say is that to the extent that we can assess needs and meet those needs early on, I think that will be a way for us to, throughout the rest of the continuum, the health, safety, and justice continuum, have savings. And
thank you.
We're
going to now go to our public comment. And this is 4 items for pretrial services 92 and 93.
Our first speaker is David Parker. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Can you hear me okay?
Yes.
All right, supervisors, I'm David Parker, a former justice system clerk with the county of 13 years. And I sent you emails detailing what I'm about to say. I'm asking you not to delete any clerical positions in pretrial services. In October, due to a medical condition, I thought I needed to resign. And after speaking with my doctor, I intended to rescind my resignation, and I was told I wasn't allowed to. I have attempted many times under the merit system rules to be reinstated to the vacancy. Director Matthew Fisk has effectively and practically obstructed my reinstatement. He has continually misled me about the position having already been deleted and has misled you and the SEIU about its vacancy. After the vacant code was posted in January, I applied for reinstatement, and 2 weeks later, Mr. Fisk deleted the HR vacancy through HR. In February, I was told I would not be reinstated. I ask you through the county executive to direct Mr. Fisk to reinstate me and keep that clerical position. Thank you.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you, everyone. Scott Largent. And, you know, I always enjoy what you have to say, Matt. And I do appreciate the fact that you try not to sugarcoat things. And what I noticed, it was almost like you weren't going to say your last comment and you realize it's very important to get it out there. One of these days, I would love to get that from every one of you on this committee, at least for the Justice and Public Safety Committee end of things, rather than the report submitted, no comment, everything's okay. Thank you again, Matt, for what you have to say. I think you're in the right position here for our county. I've always supported what you're doing for our county, and I more than appreciate your support of coming up to me in the hallway and just trying to make sure I'm okay. I'm somebody that's just trying to fight to become a father, and at least somebody on this panel is actually paying attention. So thank you. And hopefully I don't end up in pretrial services fighting for my kids. So thank you.
Our next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon. I was calling in to show my support and our collective support in the Protected People budget for pretrial services, namely under the larger frame, which is the goal to decarcerate. And if decarceration is the most fiscally prudent direction as well as the morally correct one, then it's about supporting agencies that are getting people out of jail. And that means supporting the pretrial office as well as the public defender's office. If increasing incarceration is the goal, then certainly maintain those resources in the DA's office. But if success is evaluated by reducing incarceration, then supporting pretrial services in their new imagination, which is as a community partner, not as an extension of the system, is the correct move forward, and is something that I see and hear and experience in Matt Fisk's leadership. And I hope that we could build more community partnerships to get people out pre-trial so they can be with their families and communities.
Thank you. Those are the public comments. I'm now going to go to the board. I'll start with Supervisor Cortese. See if there are any comments.
None for me, thank you.
Thank you. Supervisor Ellenberg?
No comments on 92 and 93.
Thank you. Supervisor Simitian?
No comments at this time, Madam Chair. Thank you.
Supervisor Wasserman?
Oh, ma'am.
Would you like to make a motion, Supervisor Wasserman?
Sure. I move 92 and 93, including forwarding them to Friday.
We have a motion. Do we have a second?
Second.
Thank you. We have a second from Supervisor Cortese. I just wanted to make one comment, and that is that I appreciate that we added positions here in June. And this is one area where we may need to add more positions. And I think that falls in the category of both clerical, as David raised, but also just in terms of folks for oversight. The numbers are really significant. And then the other thing I would just say, I know that Supervisor Ellenberg, as chair of the Public Safety and Justice Committee, that better understanding how cases within pretrial can be prioritized for, in terms of services is going to be, I think, one big next activity. And you might already be looking at it, but I just wanted to raise that as an opportunity for us to think more strategically about this body of work. And thanks, Matt, for all your work. So we have a motion and a second. May I ask for a roll call vote?
Supervisor Ellenberg?
Yes.
Supervisor Simitian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Yes.
President Chavez?
Yes.
Thank you.
We're now going to go to criminal justice system-wide costs. This is items 94 and 95, and this is the reductions in AB 109, and then a referral of those AB 109 reductions to the Friday meeting. We have no public speakers on this item that I can see, so I will. I'm sorry, we do have one public speaker. May I go to the clerk?
Our first public speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, everyone. Scott Largent. There's going to be a lot of people that are not going to be eligible for the AB 109 funds pretty soon here. I believe we're going to have estimates of 40 to 50,000 more homeless people. A lot of people are going to be entering the criminal justice system that are not familiar with it. And we know where these funds go to. What are we going to do for the people that can't access this money, that can't get the proper treatment, that, you know, can't? I talk a lot about this. I've been going on and on about this. Maybe we can set something else up out, maybe behind the city hall out there, start giving people water, get them hydrated, offer services and help through volunteers. I understand we can't tap into that AB 109, but why should people be thrown into a creek when they're not a felon, when they're not re-entering the system here out of prison? I don't understand it, and I just think people need more help, and I think we need to open our eyes up. Thank you.
Thank you. I do not think we have other speakers on this item. Is that correct?
Correct.
Great, thank you. So I'm now going to go to the board for action. Are there any comments from any of my colleagues? Supervisor Ellenberg?
Thanks. I'm concerned with the way that we've cut the AB 109 funds across departments without any information that presents a clear understanding of the impact specifically to services, both in custody and in the community. And really, it wasn't until board aides requested details on these cuts that we were given any information on the types of services and community partners that were impacted. And this lack of transparency is concerning. I don't know if we can expect additional cuts to AB 109 in the November budget discussion, but going forward, I'd like to request that administration provide a way for the board to review all AB 109 funded services and positions in one place so that their impact can be considered as a whole.
For Friday, Supervisor Ellenberg?
No, I said to the November, if more cuts are coming in November,
yeah,
to have it then.
Got it. Thank you.
Thank you.
Any other comments on this item? I'm going to ask if my colleagues have, if anybody would like to make a motion on this item. Supervisor Wasserman will move. You're going to make a motion?
Yes, I just had to, I will move it forward as recommended.
Thank you. We have a motion to move it forward as recommended. Do we have a second on this item? We do not have a second on this item. Is there an alternative motion?
Supervisor Chavez?
Yes.
I would recommend that the suggestion made or the recommendation made by Supervisor Ellenberg actually just be expedited to prior to adoption of this budget. I mean, she was asking for AB 109 to be consolidated in one place. I know on packet page 80, there's a sort of a piece of that done, but I'm not clear, you know, that's everything. And especially given that we've had some separate and prior items to this one. So maybe we could do that just to get from here to Friday without a recommendation, whether this be included in the budget or not at this point.
Thank you.
That'll be my motion.
That'll be your motion. And then
I'll second that.
Okay, we have a motion and a second. Any more discussion on the motion? Then that'll be, we'll have a, oh, no, Mike? Yes? Okay, go ahead.
Thank you. Through the chair to the county exec, please. I just wanted to make sure there's a number of things we're putting off to Friday to be discussed further to gather more information to hold a vote on. Will that allow us to get what we need done at that time? Or do we need then on those items to bring them forward at a subsequent meeting like Tuesday?
No, during these hearings, actually the actions that the board formally is expected to take is to make comment and then forward those comments to Friday, and Friday will be when the board will approve the budget in total. It has to be done on Friday. So We will try to get you as much information as you possibly can, realizing that on Friday we have to have a motion for a balanced budget.
Decisions have to be made on Friday.
Right.
Thank you.
All right, so we have a motion and we have a second. Is there any more discussion on the motion? Seeing none, I'm going to ask for a roll call vote.
Supervisor Ellenberg,
Yes.
Supervisor Simitian,
Forgive me, Madam Chair, could you repeat the motion? I apologize. I had to step away briefly.
The motion is to take item 94 and 95 and move it without action to Friday, pending a whole list of all cuts to AB 109 and the impending impacts.
Thank you. Simitian, aye.
Vice President Wasserman,
Yes.
I apologize, Supervisor Cortese,
Aye.
President Chavez.
Yes.
Thank you.
Thanks very much. We're going to now move to the Office of the Sheriff, and this is items 96, 97, 98, and 99. If any public speakers would like to speak on this item, the time would be now to put up, I'm sorry, I was going to say to put up your blue hands, but to call in. And then I'm going to move to see if Greg, if you want to make any overarching comments.
I don't at this time. I'm not sure if Dr. Smith has anything though.
He does not have his little blue hand up.
Okay.
So I will go to Sheriff Smith to see if Sheriff Smith would like to make any comment.
Yes, thank you so much, Supervisor. We at the Sheriff's Office are dedicated to the preservation of public safety, and we've done that for many years. We understand these are difficult times right now, and for all the public speakers and all of the public, we're listening. We want to make changes. We want to make changes within our jail system and within our patrol areas. I also want to recognize the men and women of the Sheriff's Office. We are essential employees. We've all come to work every day, worked hard, and we understand the risks to public safety and really also to the public at large. As a result of COVID, we have started tracing units and a lot of other services that we haven't had in the past. We recognize the confidence of the public that we serve is really essential. And with that comes the need to constantly review and refine what it is that we do at the Sheriff's Office. We have a lot of training, our CIT training, our mindfulness, our de-escalation, and those are programs that we really, really want to continue. In terms of the budget, in 2020 so far, we have had a budget reduction of 9.8 million, which cut about 30 positions and reduced overtime expenditures in both the jail and enforcement by about $1.5 million. We now face additional budget cuts and budget reductions, and we've been asked to take a further reduction of $37 million. That's a total of $48 million that the Sheriff's Office has been requested to cut. We understand from the Harvey Rose audit that the county's budget deficit is about $400 million, and 300 million of that is the Valley Medical Center and the hospital loan. That means there's a budget deficit of about 100 million. And with us being asked to take a budget cut of 48 million, the Sheriff's Office alone is now responsible for about 48% of all of the budget deficit. That is really, really a huge impact on our agency. The proposed budget will cut 225 positions out of the 3 budget units within the Sheriff's Office. And yes, those positions are vacant, but in our office, we have post positions. So if there is a vacant position, that person is required to either be on that beat or be within that housing unit in the jail. So we have relied on, even though we have vacant positions, we've relied on having the overtime money to be able to fill those positions. So vacant positions in our office actually means that we're filling them with overtime. Because of that, what we have to do is identify 225 functions that we have to stop doing within the sheriff's office. And we just got this additional budget target recently. So I'm not sure that we have actually really analyzed the impact. I really believe that there needs to be an analysis of the impacts, including the legal mandates that we have, the consent decrees that we have, because we need to continue with the jail reforms, with our consent decrees. And we've been working very, very closely with the prison law office, and we've made tremendous strides within the office on jail reform, especially as it relates to our not only legal mandates, but our consent decree mandates. We have virtually eliminated all mandated units within the sheriff's office in the first budget round. It looks like we'll be taking about a 21% cut in our enforcement division in the sheriff's office. We'll no longer be doing rural crimes, marijuana eradication. We'll no longer have most of the task forces that we have now. We also don't believe with this level of cuts that we'll be able to maintain mandated services, and we won't be able to meet the newer mandates. And a lot of them have to do with law enforcement reform, the reporting of certain crime, certain information on our staff, and also with having to work hard to provide Oakland with information so we can have the oversight model. I asked the board to consider the long-lasting impacts of these budget reductions in line with the core missions that we provide and the mandated services that we provide to the county. I believe drastic cuts such as these are premature given the unknown economic future. We don't really know the full impact of what the state or federal government will do right now, but I know this will have a devastating impact on our office and be able to fulfill what it is that we have to do, and especially in keeping in line with the reforms that we want to. So I'm actually asking for a more in-depth analysis of the impacts of this level of cuts within the sheriff's office. For us to absorb 48% of the entire county general fund deficit, I think needs to be reviewed a bit more closely. And I'm open for any questions.
Thank you, Sheriff. I'm going to go to the public, and then I'll come back to the board. And so I'm going to ask if the clerk could acknowledge and receive the folks who are waiting to speak to us.
Our first speaker is Liz. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, this is Liz Lacey. I am a union member of SEIU 521. I'm also a leader, and I also work at the sheriff's office. I have to say this was a very interesting slap in the face for cuts. What I should tell you is that we're already hurting, and we already have a number of vacant positions that we haven't been able to fill. And the only way that we've been able to provide the services thus far is through overtime. We have people who are already burned out. Due to those vacancies, burned out because people are retiring. We have those who have been on maternity leave. We have such a massive turnaround. These cuts will be devastating not only to the employees that work there, but it'll also be devastating to the services that we provide. Yeah, I mean, it's just overtime's going to go up, morale's going to go down. Portion of those jobs that were cut were actually not funded by the general fund, including the criminalist positions. There's a very small percentage that comes from the general fund. So again, like Rosen, I don't understand.
Our next speaker is Scott Largent. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you, everybody. Good afternoon, Scott Largent. Like all the different departments in our county, we're gonna have to make some big cuts. As far as the sheriff's department, you know, I was just hoping that we could budget to go over and above for some of the people that are suffering in our community. Our sheriff's department has the contracts, of course, with the court, the light rail, These are big dollars. What I would like to see and what I'm asking, Lori, is can the deputies be bringing out cases of water? Can they have water in there in an ice chest, and can they hand it out to the homeless? Can we provide some type of safe parking over near the sheriff's department? Can we provide a charging station? Can we provide some rehab vouchers? Can we do what the county's not going to do? The deputies are straight up involved with these people. They're on a street level all the time. And they get to know everyone. So what a better route to go. So I'm just asking, is there a way we can do more and we can get it volunteers to do it? We can get it funded by.
Next speaker is Debug Community Meeting. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking. Debug, thank you.
Hey, how you doing? This is Jose Valle. Again, I request that the sheriff adhere to the hunger strike demands that's going on right now in the main jail in Elmwood. No new jail, that the sheriff go ahead and approve the Oakland to begin investigations. One budget cut that seems to be neglected is the lack of wages for workers in the jail. I hear SEIU speaking. I feel that SEIU should also speak on workers' rights and wages for those that are incarcerated. The entire jail in itself cannot sustain itself without these workers, and they gain no milestone credits, nor do they gain any wages, nor are they protected from COVID while working. There's been a lot of outbreaks, and we've been hearing from families that might be one of the reasons why there's been an outbreak in Elmwood. Thank you.
Our next speaker is Ryan Elder. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Good afternoon, Ryan Elder with the Vice President of the Deputy Sheriff's Association. The DSA represents the frontline essential public safety workers of the Sheriff's Office. I would like to agree with Supervisor Ellenberg's earlier comment that we all have an obligation to protect every member of our community. I'm commenting about 130 plus positions being cut from the sheriff's enforcement side. That's over 100 uniformed deputies that is potentially gone. The DSA is deeply concerned with the proposed budget cuts to the Sheriff's Office Enforcement Bureau. These cuts to the Sheriff's Office are disproportionately heavy to public safety, a cost that will be put on the backs of the public safety professionals and the community we serve. Deputy Sheriff, DSA recognizes that 2020 has been a pretty terrible year for budgets, and particularly for law enforcement profession. Our ask is to have a more surgical cut.
Our next speaker is Erica McKnight. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. My name is Erica McKnight, and I'm speaking on behalf of my husband and as well as the inmates in Santa Clara County. I believe and I support that the department should be defunded. I think one way that you can gain some money and loosen up some money for your department is to get rid of the corrupt officers that work in the jail. The sheriff's office is heavy to inmate safety. Thank you.
Our next speaker is Melinda. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking. Melinda, go ahead and unmute yourself. And
oh, here she goes. Melinda?
Hello?
Yeah, we can hear you.
Hello? I don't know if you guys can hear me. I can't hear you. I am wanting to speak because my son is locked up in Elmwood, and he contracted the virus due to the negligence of the sheriff's department not overseeing the safety of them. He was asked to pick up dirty laundry and sheets and blankets of inmates that were infected, and he ended up contracting the coronavirus, which in turn he is also they're still asking them to do that right now. Just everything, the way they're handling it as far as when he was sick, they let him out. The virus is going in there because they keep asking inmates to do that, and they're bringing it back to their bunks, and it's going to keep spreading this way. And nothing is being done about that, especially when they're made to do it without proper PPE, knowing that when they were checking him in isolation, they had proper PPE, full body garb to take his temperature.
Our next speaker is Catherine Zietzer. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm going to piggyback on the last speaker. She is absolutely right. They're not wearing masks. The correctional officers are not wearing their masks 100% of the time. As I said earlier, maybe probably 60%. They're not taking care of the fact that the inmates are not being protected. They're taking the virus all over the institution through the COs with the COs, the inmates not being taken care of. And I know that it's hard for you to believe that, Ms. Smith, but they are not adhering to the policies that you have put forward. And I urge you to go in there and take a look. Take a look at the tapes. Take a look at how they're managing their own PPE. The inmates are suffering for it. It's not fair.
Our next speaker is Raj Jayadev. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Yeah, I want to support the budget cuts in the sheriff's office and the jail. And I think the jail, much like the DA's office, are a different animal altogether than other county apparatuses and agencies, meaning it's the language has been used saying it is a service. And if you cut their budget, it cuts their service. But incarceration is not a service. Health and hospitals is a service. Fixing roads, education is a service. Incarceration takes away from the community and shouldn't be funded or even understood, even in budget line items, as on parallel to those other activities. But I would also like to say, having heard from the families on a regular basis and those that are calling from inside, that I urge the sheriff's office and the board to meet with those currently detained so they could get to the issues that sparked this hunger strike, and that the sheriff's office sign through the county council the Oakland agreement so that we could start get some independent perspective and oversight of the jail.
Our next speaker is Andrew Bigelow. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hey, my name is Andrew, organizer with Silicon Valley Debug. I would also like to support the budget cuts for the sheriff's office and corrections office. Want to also encourage the sheriff and the board to meet with the folks inside, the loved ones inside who are striking, and to listen to them and to trust what they're saying is real, and what all their family members who are coming to these meetings and telling these dire situations of what their loved ones are going through is real. Families of loved ones incarcerated in Santa Clara County have been talking and dreading about this moment since March, when COVID outbreak and the lockdown happened, folks were not listened to, and it escalated into what it is now. Please listen to the folks who are experiencing this firsthand.
Our next speaker is Michelle C. I'm unmuting you. Please accept the unmute. You'll have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm a resident of Santa Clara County and a member of Showing Up for Racial Justice at Sacred Heart. I support the Protect Your People budget, and I echo the concerns of Silicon Valley Debug and the other family members you've heard about. And I also urge the sheriff to look into the bad COVID safety precautions in the jail. Thank you.
Our next speaker is Benet Vihar. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hi, I'm Benet with Silicon Valley Debug. As you all know, I'm really familiar with the with Ms. Chavez and everything that we've been doing. Back in 2015, Ms. Chavez was so kind to go visit my husband inside and talked about these issues that are still going on until today. And I support the budget cuts for the sheriff's office, and I meet with families and I hear their stories, and they need help. The guys inside really need help, at least with COVID. I'm for the Protect Your People proposal, and if it goes through, this is life changing, and for the community, this is for the community. This is the real community speaking. Thank you for taking the consideration to hear us out.
Our next speaker is Cecilia Chavez. I am unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Hello, I just want to echo everyone else's concerns that have been raised in regards to this particular budget item. I'm also an organizer with Silicon Valley Debug, so we definitely hear all the stories that the loved ones inside are currently going through, and have sat through numerous board hearings as well, where we're talking about the conditions inside, and then a representative from the sheriff's department openly says, oh no, this isn't happening. We are wearing our mask when we have accounts after accounts after accounts that protocols aren't being followed, which has resulted in the outbreaks that are happening because individuals inside are not seen as human beings. This needs to be a completely cultural change, more so than just a budget cut.
That concludes our speakers.
Thank you, Jess. We're now going to go to the board. I see Dr. Smith has his hand up. I'm going to go to Dr. Smith and then Dave and Susan.
I didn't realize I had my hand up, but I guess I'll talk right now. I just wanted to reframe a little bit what the proposals are for the Sheriff's Office and the Department of Corrections. Again, reemphasizing these are all vacant positions, so there should be no need to eliminate services, particularly change the patrol in the rural areas or change significant patrols. But what I heard from the sheriff did trouble me, because basically what she said was that she needed the salary savings from these vacant positions in order to run the agency on overtime. And since there's been problems with utilization of overtime, I think that emphasizes the need for the board to move ahead with the reductions. And if there's valid overtime in the future, we can always reassess that at a future time. But if we're using salary savings on a large number of vacant positions in order to guarantee overtime, that's not a very good use of general fund dollars. That's all I have to say.
Sorry, before we leave that topic, I just want to make sure I understood what Dr. Smith, what you just said. What you're saying is that you use the term guaranteeing overtime. I want to better understand what you meant by that.
What the sheriff said was, don't eliminate these vacant positions because we rely upon the salary savings in order to pay overtime for posts. And what I'm saying is that if somebody is asked to work overtime in any department, we have a legal obligation to pay them the results of, pay them that overtime. But by having a bank of vacant positions, essentially you're guaranteeing that overtime, that money will be used as overtime. and not requiring the department to be judicious, thoughtful, and efficient in the use of overtime.
And based on what you're saying, you're presuming that there's a use of overtime that is not necessary.
No, I didn't say it's not necessary. I just said it's not used efficient.
All right.
Every year we fund, in addition to these salary savings, we fund additional Object 1 monies for overtime. So to hear that basically we're relying upon overtime, not only from salary savings, but also from contributions to the Object 1, tells me that it's not being used very efficiently.
Okay, well, I'm gonna let let's see if Sheriff Smith wants to respond to that, and then I'll go to Supervisor Cortese, Supervisor Ellenberg, and then I see Supervisor Simidian.
Yes, just very briefly. We've been on mandatory overtime for a long time, and it's something that we really are trying to get out of. We have a lot of retirements. The Department of Correction is actually 30 years old, and so we have a lot of retirements. Just last week, we had 30 deputies to put in the Academy for Enforcement and 30 deputies to put in the Academy for the jails. And we were not allowed to hire any of those positions and actually leave the positions vacant. So we do struggle in hiring peace officers. Not only is the hiring process a long time, but also the Academy is a long time, and the washout rate is relatively high. So we do what we can to fill the positions, and we do not like using overtime as an alternative.
Thank you. I'm going to go to Supervisor Cortese.
Thank you, President Chavez. Just 3 points. One of them, first and foremost, Supervisor Wasserman and I both made a written inquiry of Dr. Smith as to whether or not he was accepting or revising the rural patrol recommendation from the sheriff. My understanding from his response offline, I know outside of the public meeting, was that he has not. He's intending to continue funding the rural patrol in terms of the budget process. There was some mention made of that in yesterday's hearing. Because we're dealing with these items now on the agenda, I just want to ask Dr. Smith first to respond to that so we can just get on the record where we're at as we head into the end of the week in the budget adoption.
Yes, the proposal before you does not eliminate any of the deputies who are used on rural patrol. So we would expect that the sheriff would continue with the rural patrol. Although as an independently elected official, she certainly does have the right to deploy her staff as she sees fit. So it's probably good to get an answer from her.
Well, if it's the intent of the Board of Supervisors to fund those positions because we're adopting your recommendation and the sheriff decides not to deploy the resources in that way from a public safety discretionary standpoint, do we have continuing budget jurisdiction over the sheriff's budget after that?
Oh yeah, sure you do.
So I could bring back.
It would certainly be a problem if the sheriff decided to do that, since we're not eliminating any of those positions.
Right. So let me just ask Sheriff Smith on that before I ask a couple other questions. Whether or not it's her intent to accept your recommended budget as to the very specific issue of rural patrol.
So what we have to do is we have to identify over 200 functions that we can no longer perform because we don't have those positions or the funding for those positions. Rural crimes is very important. It's not one of the things that is mandated. We're going to be really struggling with how do we identify 200 and some functions to discontinue doing. And yeah, we have that discretion, and I think it's important, but I think all of the positions that we have are important. So it's going to be a real struggle for us. I understand it's the will of the board to continue that position, and that's something that I would do, but then we'd have to find another function to be able to cut, maybe another beat somewhere or something else. So we have some difficult decisions to make coming up.
Yeah, and I don't want to overemphasize the importance, but the rural, hundreds of square miles of rural patrol that's associated with the Mount Hamilton range right now is embroiled in fire. As you know, people need to be evacuated. There are people who, can't and don't have communication. Power outages hit the area as the fire was moving from Milpitas south toward Lick Observatory. There's 33 residents, as I understand, essentially at the mercy of the Sheriff's Department and other first responders to try to get out of there with essentially, at best, one way out aside from air resources, and no air resources have been deployed. That's right now. That's as we sit here debating whether or not we can afford to have rural patrol back there. So for me, the importance of this is, and I've felt this probably ever since. This may be a strange personal justification, but when I was a kid, I always felt that it would be extremely unfair on the rural bus route home from school if the last couple of kids were dropped off, 10 miles short of their home, because it was much more efficient and cost savings for the bus to just turn around, save fuel, save hours, save cost, save all the way around and just head back to the schoolhouse. And that's how I feel about rural patrol. And sure, there isn't the population back there that there is in the urban areas that the Sheriff's Department's patrolling. And by all accounts, the Sheriff's Department's doing a terrific job patrolling. We hear that from our small cities that are under contract. I don't hear complaints. I happen to live in a county unincorporated area. People are extremely happy, especially comparatively speaking with some of the other surrounding jurisdictions that don't seem to respond. But I just want to make sure we're not doing everything 98% top drawer, in terms of response throughout the county, except in these rural areas, and just have sort of the opposite reputation there that, hey, we can't get a deputy out here because, it's been cut or because the hours are so stretched. So I think it's important. I just think it just so happens that this particular day, August 18th, 2020, is one of those landmark days for why you need first responders and deputies who know the area available, in that backcountry, in these rural areas. I want to move on to AB 209. This is more of a procedural issue. Earlier, there was a motion. I made the motion to take the AB 109 cuts, regardless of where they show up in the budget, and move them to Friday to deal with as a complete package. And some of the AB, I think item 100, is it? Or item 99. One of the items here is an AB 109 item. So I just want to clarify, I guess with Dr. Smith, that he understands to move that item to Friday also with the rest of the AB 109 items.
Dr. Smith? Dr. Smith, are you with us?
Sorry, I'm having trouble with my mute button. Yes, we understood that to be true.
Thank you.
I think that would be just to save time, I think that would be the same when we get to the Department of Correction.
Yes, we're going to do everything coupled together.
Okay, now let me flip the script a little bit, maybe a little bit more of the Sheriff's point of view on this last question. Sheriff Smith, Jeff is talking about her calculation that, the cuts that she's facing in these recommendations are disproportionate in the sense that they're 48% of the general fund. I I can't even begin to try to calculate that myself right now on the back of an envelope. Can you comment on that? And if it's a lengthier response, perhaps we can get that back. No matter how we vote on these recommendations, I want to make sure I understand what the proportionality is of the cuts. So those board members that are okay if they're disproportionate or disproportionately high, at least understand that that's happening. And if there are any board members who want to ask further questions about that before budget adoption, that we can deal with it. But could you give us at least a preliminary response on that?
Basically, all I can say is I'm not sure what she's talking about, because the deficit that we're talking about is about 300 million. And as we showed you at the very beginning, we're looking at proposals that would end up being 140 million. So I'm not quite sure where she got the 48% of the general fund, but we'll try to work it out and give you an off-agenda memo about that.
Yeah, maybe both your office and the sheriff's office can just zoom in on that 48, what she's calling 48%, and what you would call, whatever you would say is the fractional percentage. I just think it's important to clear that up and not gloss over it. If it's a perception that's wrong, so be it. But I don't think we should wrap up the budget process just leaving that hanging. That's all. Thank you. That's all I had, Mr. Vice Chair.
Thank you. And I think it might be as simple as 140 million of the 300 million. Okay, Supervisor Ellenberg.
Thank you. Last year, I requested that a staffing study be completed on custody and enforcement positions. The goal had been to have it completed before the start of this budget process. And I certainly recognize that COVID has had a substantial impact on the progress of this work and has also shifted the way that we manage the jails. But these issues combined make the completion of the staffing study not only a great challenge, but really critically important. And that said, we anticipate additional cuts, budget cuts to this department in November. And the reality is that those cuts at that time may constitute filled positions. So in advance of that, in preparation for that, I'd like to ask administration in partnership with the sheriff to please present a staffing study to the board in advance of the November budget hearings. I also want to really impress on the, sorry, I'm having a technical issue here. Note that it is part of the purview of OCLEM is to advise the department on maintaining a culture and level of services that align with county values. That's literally the ordinance language. So completing that review and sharing that information with County Council and with OCLEM is really, I think, going to be a critical piece to helping us think through this holistically. So with regard to that, can you give me either Sheriff Smith or County Council an update on where we are with OCLEM? Has that been signed? Hi, Martha.
Martha?
If I may, unless the sheriff would like to go first, I can provide an update.
Please.
Happy to hear it. Oh, sorry, Mike. Thank you.
So just as a very, I know it's late, so just as a very brief reminder to set the stage for my answer. In 2018, the board directed that the staffing study include both enforcement and custody divisions of the sheriff's office, and the board provided the significant input on the scope for that study. A lot of documentation on the custody division has been provided by the sheriff's office, which is much appreciated, to the consultant. They're called CGL. CGL continues their work on the analysis of that data. As you just mentioned, it's important to have an effective final report that in the end informs the budget discussion.
Yeah.
But in order to complete the custody portion of the study and begin the law enforcement portion, we need the cooperation of the sheriff's office to continue their work with the consultant. They've been in a holding pattern for a while now. There needs to be a lot of work done by the sheriff's office and the consultant And frankly, a final report by fall is optimistic to inform the November budget discussion, but with a commitment to do a lot of heavy lifting in the next month or so, it could be done and finalized by early 2021. That concludes my comments.
So it looks like Sheriff Smith, are you leaning forward to weigh in on that?
Yes, please. This has been going on since 2018, and initially it was for the custody side. That's all done. It was my understanding the county had already gotten a draft report from CGL, and we've been waiting for that for quite some time. We are not pausing at all on the enforcement. They can be done as they were initially scoped in separate portions, but I really want to see the staffing study for both sides. And I think that the custody one, there's a draft, but I'm not certain. If so, I've not seen it. The contract is with the county exec's office.
Next, does county exec want to weigh in? That was Martha. I mean,
I can weigh in.
Leaving me almost speechless, but not quite.
Not quite. I can weigh in. First, can I address Supervisor Cortese's question about the percentages, just to get it off the table? Is
sure.
In the revised recommended budget that you have before you, out of the 144 million, we were suggesting 37.8 million out of the sheriff and DOC, which is 26%, which is not 40%. Anyhow, to go back to your question, I think Martha is correct in the sense that we have had reports back from the consultant that there still needs to be information collected, and that there's been a lack of information transfer. Now, I don't say that in the sense that, you know, the sheriff's office has been doing anything wrong. I just think that maybe they've been preoccupied with everything else that's going on, but we'll reemphasize the need for speed and move ahead.
So we're talking about speed in two lanes here, the staffing study and the OCLAM contract finalization.
Well, OCLAM, I can't give you an authoritative answer. All I know, you know, that's between the sheriff and county council and OCLAM. All I know is it doesn't seem to be done yet. There had to be a signature. There had to be one with the county exec's office. I signed that quite some time ago. I don't know what's going on with
James,
the other agreement.
Can James help with that?
Sure. There are 4 required confidentiality protocols for OCLAM. And just to be clear, that's with respect just to confidential information. So there's obviously a tremendous volume of information that is not confidential. In fact, much information is even subject to public disclosure. But with respect to confidential information, the protocols with the county counsel's office, the county executive's office, and the Department of Correction through the chief of correction have all been executed. The protocol with the sheriff has been drafted. Those drafts have been provided to the sheriff's office and to OCLAM. Both sides actually had proposed changes. And so that is in process of being negotiated.
And do you feel confident that those negotiations are moving forward and that we can look forward to having a signed agreement in some reasonable amount of time? Reasonable perhaps being a week or 2 or 3, but not more?
I'm confident that they're moving forward. I'm not 100% sure that there will be agreement on all points, but I believe that the areas of concern or disagreement will narrow significantly, and that we're not. I don't believe that it's at a point yet where there is impasse.
Great. And if it gets to a point where we can agree on 80% or 90%, can can that still go ahead while we figure out what to do with the remaining 10 or 20%, or does that hold up the whole operation?
There's certainly no reason why it couldn't be done in pieces.
I would recommend that if we start to look like we're getting anywhere near an impasse, let's go ahead with what we can agree on and then move ahead piece by piece as necessary. We've promised this to the community. We have hired a contractor. We have spent many, many meetings discussing this. And I think it's essential in our accountability to the public that the work gets started.
We will certainly propose that to both the sheriff and to Oakland.
Thank you so much.
So Supervisor Simidian?
Thank you, Madam Chair. Forgive me, the lights in the building are flickering here. I think at this point, to help move the conversation along, I'd simply like to move the administration's recommendation for items 96, 97, 98, and 99, which I believe is the cluster that relates to the sheriff.
Happy to second.
We have a motion and a second.
Just to clarify,
Please.
we talked about 97 being moved to Friday without action at this point. As I understand, all those AB 109s are bundled together now. Later we have that for correction, and we also have that for probation. I think those are the last two for today. I just want to make sure the motion is.
Yes, Supervisor Simidian, do you want to adjust your motion, or are you comfortable with the motion?
No, I could. I'd be willing to move approval of the staff recommendation on 96, 98, and 99, if that would help address the unresolved issue that Supervisor Cortese refers to.
And that works for me for the second.
And that would then move 97 to Friday with more input from the county exec's staff.
Is that in the motion, Madam Chair?
That yes, that's what I'm asking Supervisor Simidian.
To be clear, yes, it is in the motion, and that would move item 97 to Friday for consideration and possible action at that time.
Thank you. Supervisor Ellenberg, you're comfortable with that?
I am.
Great. So we have a motion and a second. Is there any more discussion on the motion? Seeing none, I'm going to ask for a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Yes.
President Chavez?
Yes. I'm gonna, oh, I'm sorry. Thank you. That passes unanimously. I want to make one comment, and just to raise a concern about the issue raised by the sheriff relative to mandates and the consent decree. And I just wanted to say that after reading the staff report that takes these actions, there was it felt to me like there were I could not get from the staff report, which was 2 pages, whether or not there had been a review of the mandates and the consent decree. And I am interested in at least having staff report out on that on Friday as part of the report out. I mean, not as part of, but in addition to the report out on AB 109. Dr. Smith, is that doable?
Sure, yes.
Thank you. We'll now go to the Department of Corrections. This is 100, 101, and 102. Is there any comments from Greg Atiria?
No comments, nothing besides what's already in your packet.
Thank you. Any, Sheriff, would you like to weigh in on 100, 101, and 102?
No, but I am available for questions, and we have some members of our team here too.
Great, thank you. So for, I'm going to see if there are any comments from the public before I go back to the board for action or discussion. None. I'm going to go to start and see if there is Supervisor Cortese, if there are any questions.
No. In fact, I'd be happy to make a motion at the appropriate time.
All right. Do you want to go ahead and do that now, Dave?
Yeah, we'll move 100 to Friday with the AB 109 bundle that's coming back, and then 101 and 102 to Friday for final action.
Thank you. So we have a motion. Do we have a second? We have a second from Supervisor Wasserman. Any discussion on the motion? I'll start with nothing from Dave. Susan?
Yep.
Mike?
Nope.
Okay, and Joe, I don't see your hand up either. So with that, I'm going to ask for a roll call vote. I do want to let my colleagues know I appreciate AB 109 being moved. I'm concerned about 101 in part, again, because we don't have much information in the staff report. So I don't feel like I have a strong enough handle to understand what, if any, impact there will be to the service provision within this department. And so I'm concerned about it. And again, I'm going to ask if it's okay with the maker of the motion. I apologize that I didn't do this sooner, that the mandates and consent decree also be considered on Friday as part of this action. Is that okay with the maker of the motion?
Yes.
Okay. Thank you. Roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
Yes.
Thank you.
We're going to now go to items 103 to 107. I'm going to thank the sheriff for joining us. I'm now going to go to probation. I'm going to see if Greg would like to make any comments to 103 through 107.
Okay, nothing besides what's already in your packet. Thank you.
Thank you. And then Chief Garnett, do you want to make any comments?
No, President Chavez, I'm fine with what we've submitted. Happy to answer any questions.
Thank you. With that, I'm going to go to public comment and ask the clerk if you can call public comment.
The first speaker is Mark Murray. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Thank you. Honorable supervisors and executives, my name is Mark Murray. I've been honored to serve as president of Local 1587 for the past 16 years, and I'm grateful for our positive working relationships. I first wanted to recognize the effort of the administration to avoid layoffs during this budgetary reduction cycle. However, for the first time in those 16 years, I must speak out against process. I certainly understand the pandemic has changed the way we do business. However, despite repeated requests to review the probation department's budget reduction plan over the past month, the document was not provided until yesterday. Just 1 day for review does not provide stakeholders sufficient time to discuss the impact of these recommendations, nor does it provide decision makers adequate alternatives. As you are aware, the criminal justice system has increasingly shifted efforts from incarceration to community supervision and from state control to local control. My members, raised and educated in our community, are most effective professionals to ensure the significant transition is done safely and effectively.
That concludes our speakers.
Thank you. I think we have one more speaker. Could we take that speaker and then we'll move back to the board?
Yes, our next speaker is Salvador. I'm unmuting you. Please accept the unmute. You will have 1 minute to speak. The timer will start when you begin speaking.
Yes, hello board. Thank you for letting me speak. I'd like to speak that I think this process is unfair. Like President Murray of our 1587 union mentioned, that the chief has not been very transparent at all. Actually, she has not been transparent. And this is very disappointing that despite our requests, she has not shown us our budget. I'm also deeply concerned that out of all her recommended cuts of positions throughout the department, not a single cut is being made from her executive team. And this goes to show you that she doesn't truly care about the line staff. Every position that's going to be deleted is coming from line staff. We have way too many executive managers. There can be cuts there as well. There's no reason why it should all be line staff. And also for juvenile hall, She's recommending cutting 3 positions. It should only be 2 because I was reinstated by unanimous vote on October 2nd, 2019, and I will be back.
Thank you. I'm going to then go to the board for comments and questions. And Supervisor Cortese?
Done. Thank you.
Thank you. Supervisor Ellenberg?
No comments.
Supervisor Simidian?
No comments, Madam Chair. Thank you.
Thank you. Supervisor Wasserman?
No comment, just additional concern like we have in all the departments on the services that we need to provide and people out on probation and not in jail. It's I think decisions we make today, we'll be reviewing and looking at 6 months from now and adjusting and with whatever the new normal is or our economy is or what our needs are. And I think we can only do the best we can today with the information that we have today. And we're all going to be working on this together for quite a while.
Thank you. Is there a motion from the board? From any member?
I would move the items as recommended with the exception of the AB 109 item being moved to Friday.
We have a motion. Do we have a second?
I'll second.
And was the second from Susan? I'm sorry.
Mike is welcome to it.
Oh, okay. It was I couldn't tell. Your lights went off at the same time. Okay, Supervisor Wasserman, we have a motion and a second. Any comments on the motion? I'm just going to make one that this area, I'm going to support moving this to Friday, but I just want to make this, actually, I'm not even sure I'm going to do that, but I appreciate that the motion includes moving AB 109 till Friday. My concern here is the same I have with pretrial services, that we're moving a lot of people out of our systems out into the community, and having support there is really critical. The other thing I'm concerned about is just, as it relates in particular to juveniles, we are really working hard to fight recidivism, and losing a person from prevention and earlier intervention and also from CSEC are concerns of mine. And these are areas, again, that we've worked really hard to create an opportunity for these services. And I think the point, Supervisor Wasserman, that you raise is a very good one, which is, we're really going to wrestle with this, but the parts of our system that I think need to stay strong are the ones that keep people out of custody and keep them from getting deeper into our system. So I'll support moving this to Friday, just as I did with the other 2 items, but I'm still, thinking a lot about whether or not I can support these as a direction for the board. So can I ask for a roll call vote?
Supervisor Ellenberg?
Yes.
Supervisor Simidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Aye.
President Chavez?
No.
Thank you.
Thank you. We're going to, our last, second to the last item is the medical examiner and coroner. And I really just, I think I'm the reason this was kept off. I don't know if there are comments from Dr. Jordan or from Greg.
No comments besides what is already in your agenda packet.
Thank you. And I see that Dr. Jordan is with us. Thank you for joining us. I really just had a question, and this had to do with, we had a Harvey Rose audit that looked at both some changes and also potentially some support. And I just wondered if, I'm nervous about this coming back, this department coming back in the October-November timeframe, because it seems like a pretty lean department. And I'm wondering if the staff is looking at the Harvey Rose audit, or will they, prior to bringing any recommended changes to this budget back to the full board? That may be a question, Dr. Smith, for you and your team.
Yes, that's a question for me, and yes, we will look at it. The MEC's office is pretty short-staffed most of the time, and the medical examiner coroner, Dr. Jordan, works wonders getting it to work. She's even come up with a plan during COVID to split shift the staff so that they can avoid exposures, because exposures to dead bodies are just as bad as exposures to sick people in hospitals. So we're going to be looking at all of that very carefully, and we'll look at the Harvey Rose report very carefully.
Thank you. With that, there are no other questions. Just want to make sure we didn't lose that drop that through the cracks. May I get a motion to refer this to Friday?
Move approval.
We have a motion
That's
from
Cortese.
Supervisor Cortese, a second from Supervisor Wasserman. We'll now go to a roll call vote.
Supervisor Ellenberg?
Yes.
Supervisor Semidian?
Aye.
Supervisor Cortese?
Aye.
Vice President Wasserman?
Yes.
President Chavez?
Yes, thank you very much. I want to thank all of my colleagues and everybody who participated today. Are there any items for consideration that any board member wants to raise in addition to what's been raised already? Seeing none, we are recessed. We are recessed until Tuesday at 1:30. I'm sorry, Wednesday. Sorry about that. I read my notes. See you Wednesday. Thanks, everybody.
There you go.
It sure did.